Respected speakers and scientific committee, honorable guests and colleagues, ladies and gentlemen, good morning. As a conference chairperson, I am pleased to welcome you all to the Quality in Healthcare Forum as a part of the Global Health Exhibition 2023, named in this year Enhancing the Quality of Healthcare Services. The Quality in Healthcare Forum, supported by the Quality in Healthcare Association, is a leading platform concerned with enhancing the quality of healthcare delivery and patient safety in the Kingdom, aligning with the Saudi Vision 2030 and the healthcare transformation programs for improving the quality and efficiency of the healthcare services. With the endless evolution of technology, there is a need to improve the quality of healthcare services by transforming and digitizing the healthcare system, implementing value-based care services, fast-track patient experience towards improving patient satisfaction and well-being. The full day agenda will cover a wide range of topics and will welcome key leaders and high-level subject matter experts in the field of healthcare quality, who represent key leading healthcare organizations and who will enrich the discussion and knowledge sharing. I would like to thank you for your commitment in seeking knowledge, and we hope you enjoy the forum and are able to gain a valuable finding and recommendations that you can apply to advance your practice. I would also like to thank the valuable support of the Ministry of Health, His Excellency the Minister of Health Fahad Al-Jalajil, and His Excellency the Vice Minister of Health Abdul Aziz Al-Rumeh, and all the Ministry of Health teams. All thanks also go to my colleagues in the Quality in Healthcare Association for their valuable support. I would like also to take this opportunity to thank the Global Health Exhibition organizer Informa Markets for their sincere efforts. Thank you and hope you enjoy. Thank you very much. Let's start. What do you think? Now, we start with our first session, and I would like to introduce our first speaker, Dr. Nahar Al-Azmi, Secretary General, Saudi Health Council, Riyadh, Saudi Arabia. Dr. Nahar Al-Azmi is the Secretary General of Saudi Health Council with more 25 years experience in hospital operation and clinical practice. He is a family physician since 1997, gained master's at King Saudi University, and later achieved a diploma in child health from the Royal College of Surgeons, Ireland, and an executive master of healthcare administration from Washington University, St. Louis, USA. Saudi Board in Family Medicine, as well as the Arab Board in Family Medicine. But it's not just his professional achievement that make him special. As a former Assistant Deputy Minister for Hospital Affairs at the Ministry of Health, board perspective on healthcare, including healthcare strategy, planning, commissioning, and operation. In addition, he served in several leadership roles. The founding CEO of Prince Mohammed Medical City, a major healthcare project in the northern region, played a leading role in the commissioning and operating of King Fahad Medical City in Riyadh, where later become Executive Director of Medical Affairs, Executive Director of Academic and Training Affairs, and Continuous Professional Education. Also served on the Board of Directors of the Medical Cities and Specialized Hospital. Under the chairmanship of His Excellency Minister of Health, 3 years experience in the private sector as the first Chief Medical Officer of Ad-Dara Hospital and Medical. Ladies and gentlemen, please join me in giving a warm welcome to Dr. Nahar Al-Azmi.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, ladies and gentlemen. It's really my pleasure to speak today on behalf of my team and my colleagues in the Saudi Health Council about implementation and contribution of the Council towards quality in healthcare system. I'll try to be brief and cover 4 points in our presentation. It will be about the healthcare system overview and the Saudi Health Council journey, then the Council contribution to quality, and finally it will be about some initiatives in the health sector in general. The Saudi Health Council, in fact, has a history and a legacy of more than 80 years. Probably no one imagined that in the late 1920s of the last century, some of the health administrations and some emergency services were started. Then until the 50s, 1951, Ministry of Health was established, and this is where the health system got organized and started to deliver some sort of services to the community. As you know, infrastructure, investment, the human resources, obviously, where most of them are from the non-Saudi colleagues who were working, delivering the services, and even planning for the system. Over the 70s, 80s, and 90s, there was a lot of investment in the infrastructure, building hospitals, building health facilities, and also investment in human resource. I would say that thousands of Saudi physicians and nursing and allied health went abroad to get certified and come back to practice and even lead the planning and improvement of the system. So in 1995, the kingdom was declared as polio-free, which is one of the important milestones. In 2002, the Saudi health system was approved by the royal decree. This is where the system also got more organized and more mature. And this is the year where in the same system, in Article 16 and 17, Saudi Health Council was established with the defined mandate of the council. Through the whole years, the both building and improving the system was going on until now, 2015, 2016, when we have the launching, Prince Mohammed bin Salman launched Vision 2030, and this is a huge milestone with aggressive, serious journey towards change and transformation. The system is a huge system. We are talking about more than 500,000 workforce. We're talking about more than 77,000 number of beds and more than 497 hospitals. This is across the public, private, and all the sectors. So this is just quick, examples of some of the numbers. And if you can see here, Ministry of Health, for example, in 9 years, from 2012 to 2021, there was a growth of 11% in the number of hospitals. In the private sector, more than 14% growth in the number of hospitals. And in the governmental hospitals, apart from Ministry of Health, there was a 31% growth in the number of hospitals. So if you can see over the last 9 years, significant and huge growth in the system. For example, in the number of beds, as you can see, 26% growth across all the sectors. This definitely reflects a serious process of building and interest in investing in the system from the government and from the private sector. The number of physicians and dentists also, huge increase over the last 9 years. Almost 70% in Ministry of Health, 53% in governmental hospitals, and 87% in private sector increase. The same thing in nursing workforce, huge growth, almost 80% in the private sector, and 30% in the Ministry of Health, and 50% in the governmental hospitals. The same thing for pharmacies and pharmacists. As you can see, 100% growth in the numbers. In the allied health, another significant increase in the workforce. So as I said, in 2002, the health system was approved by the custodian of the two holy mosques, and the Saudi Health Council was established with the mandates of the council, and the council is formed of, chaired by His Excellency the Minister of Health, and the members of the council are the all entities in the healthcare system, whether regulating entities like Saudi FDA, Saudi Commission for Health Specialties, Ministry of Health, CCHI, or care providing entities like Ministry of Health, Military Services and National Guard, Ministry of Interior, and Ministry of Defense, and also some supporting members like Ministry of Finance, Ministry of Higher Education, academic hospitals, and Waqaya as the public health authority. So the mandates of the council focus firstly on establishing and building a strategy for health in the country, and also integrating and producing the policies and regulations, and maintaining and ensuring that a coordination among the system at all levels, at the levels of policy making and even at the level of capital investments or level of care provision. But in the same time, there was a special emphasis on quality and defining that the mandates of the council is to ensure that the care is provided in acceptable and high quality. Our vision is to be an inspiring benchmark for the world-class Saudi health system, and our mission is to establish regulations that ensure coordination and integration among health stakeholders to improve and enhance healthcare. One of the first products before 2015, the only strategy which was driving and setting the direction of the system was the healthcare national strategy, which was approved and developed by the council and finally approved by the royal decree. That was in 2009, with basic elements of this strategy, focusing on funding and the role of Ministry of Health and private sector. But again, quality assurance and performance efficiency and periodic evaluation of health was also clearly mentioned as one of the essential essences of this strategy. And by the way, in 2015, a lot of initiatives were started based on this strategy, which was aligned with the health transformation and the Vision 2030 initiatives. Under the umbrella of the Saudi Health Council, a lot of Saudi national centers. So I'm sure all of you know SIBAHI, which is the Saudi Center for Accreditation of Healthcare Institutions. It was, in fact, a decision, one of the decisions of the Council, and now we can definitely see and witness the impact of the accreditation process on the quality of care. We also have the Saudi Center for Patient Safety, where you can't definitely divide safety from quality, and the Center for Organ Transplantation also is under the umbrella of the Saudi Health Council. Under the General Secretary, we have 7 national centers. The biggest one is National Health Information Center, which is now leading the digital transformation in healthcare, leading, in fact, the whole pillar in the transformation. And at the same time, we have the National Cancer Center, National Heart Center, National Diabetes Center, National Center for Evidence-Based Practice, which is now starting the foundation process and also we just released the label of Sa'ib, where all the clinical guidelines, the national clinical guidelines, will be evaluated and approved by this center. We have also the National Center for Developmental Disorders and Health Research and Studies Center. A lot of national committees involving, I would say, thousands of experts, Saudis and non-Saudis, who are planning for the system and ensuring always that quality is always there in the guidelines and the initiatives and in the projects. So, example, home care, emergency medicine, rehabilitation committee, drugs committees, and more committees. So, SIBAHI, as you know, implement national standards for accreditation of health facilities. And in the same time, it's not only for hospitals, it's for dental services, for primary care, for ambulatory care, and also for clinical laboratories. Saudi Center for Safety also is developing and monitoring national safety indicators, sentinel events, a notification related to patient safety, and also working in empowering the healthcare professionals to ensure high level of patient safety. A lot of strategic initiatives under the council. We worked on the national strategy for diabetes, cardiac rehabilitation programs, national standards for acute coronary syndrome under the cardiac center, primary care improvement plan also was approved, a lot of guidelines for many diseases and health challenges. In enabling the digital transformation under the National Health Information Center, the telemedicine regulations were produced and approved. Now the الصحة platform for sick leaves, registration of health systems, معتمد, SEMA, which is the maturity assessment program also. And by the way, I invite you to visit our booth in the exhibition where you can learn and know more about all of these initiatives. One of the very, in fact, important projects which was started and we are still working on is the national framework for health indicators, health system performance measurement. This project is ongoing now. In fact, hundreds of experts, patient-focused groups were involved in the planning. Also, aggressive, process of benchmarking with more than 20 entities nationally and internationally and local in the regional area. So out of 2,513 KPIs which are measured internationally and nationally, there was a filtration process for KPIs which measure the health status, and which are 51 KPIs, and 58 KPIs which measure the health system. So we ended with 109 KPIs which we will be measuring and monitoring across the whole center. And in fact, the system, and we are now moving to the next stage of building the monitoring center and also the operation process and the knowledge transfer for this center. The council also consider quality in many of its decisions. So, for example, the National Plan for Quality Improvement and Patient Safety was approved back in 2018. We have also, the council approved the National Executive Plan for Primary Care Improvement. And finally, lastly, just in the last year, prioritization of the collection and accurate coding for data and indicators related to mortality cases in the kingdom. In fact, this project was closely monitored by the council. Almost in every meeting of the council, we meet 4 times a year, but a very close monitoring of the numbers and the progress in the mortality coding and indicators. This is not only at the level of the council or the general secretary. The whole sector is working on multiple initiatives and projects and big departments of quality in the Ministry of Health, in the National Guard, Ministry of Defense, and all of the and the private sector, all of the care providing facilities are having their quality initiatives and quality improvement projects, and awards, accreditation by JCI or SIBAHI or CAB accreditation, whether it's general for the whole facility or specific accreditation. In spite of all of this, these achievements, I would say, and systems which are working and try to be integrated, we definitely still have challenges, and a lot of challenges, like every system. We have challenges at the governance level, at the policy-making level, to ensure that all the policies are coordinated and ensure the quality in every policy, and in the same time, quality culture and quality providing and measurement, collecting the data, ensuring that also the healthcare professionals consider quality. I'm sure we need to invest more to have more programs. Alhamdulillah, most of these challenges are addressed by the current ongoing plan for in the health transformation program, where discussion all of these challenges at the level of the governance and level of care provision and implementation. I hope that these few minutes gave you some insight and idea about the contribution of Saudi Health Council. I thank you very much for your listening and wish you, inshallah, a useful, successful day. Thank you very much.
Okay, yeah, thank you. Thank you.
Need to switch it on.
Yes. Thank you, Dr. Nahar, for this valuable presentation and nice also information that you provide us. You have mentioned really exciting information and data. One of them is that there is a national centers, there is a committees, also there is different health sectors. So could you please give us a brief, what is the role of the Saudi Health Council in integrating all these health sectors toward achieving Saudi Vision 2030, toward providing quality of healthcare services for the community and patients? Yeah. لا.
يجي ما يقدر يجي. Hello, can you hear me?
Yes, yes.
Yes. So probably I always like to summarize the role of the Saudi Health Council in coordination and regulation. Having regulatory entities under the council and having care providing entities, and also academic educational entities, other supportive governmental entities, even the social services, which are usually close to the healthcare services provided. We need always to make sure that at the level of the policy, these policies are coordinated. This is why we have an administration for health economy and health policy, which is an active administration, always ensure that we build an evidence-based policy. We have also a regulation administration which ensure that the policies or any decision approved by the center has to be aligned with all the national systems and policies, not only in the healthcare but in the government and in the country in wide. Luckily now we have also with the health transformation, we have the Health in All Policies, which is chaired by His Excellency the Minister. It's a ministerial committee where we ensure that health is available in any system. It's not always the process of coordination is not easy. You manage a lot of stakeholders. Everyone has his scope, his objectives, his projects. But as probably I said 2 days ago, Alhamdulillah, under the Vision 2030, the direction is very clear. Now the governance and monitoring of all the vision projects or initiatives and alignment is a must now between all the different centers. So, inshallah, I'm optimistic with this journey of transformation that we will be leading, inshallah ta'ala, at the national level where we can improve our policy making and our monitoring of the quality and all aspects of our care provision.
Thank you very much, Dr. Nahar. Really, it's amazing, and looking forward for spreading and enhancing the quality of healthcare toward achieving the Saudi vision and providing a good quality of care for the community and patient in Saudi Arabia. Any question from the audience, please? Any question from the audience? Okay. Thank you very much, Dr. Nahar, for welcoming, and hope to see you. Thank you very much. Thank you very much. Okay. Now, with an experienced national healthcare leader, worked as an executive leader in both public and private Saudi health systems. Currently, the CEO of Riyadh First Health Cluster, R1, a large health system including King Saudi Medical City, 17 community hospitals, and 160 primary care centers with a total of 4,000 beds, 25,000 employees, and an annual operating budget of 7.5 billion Saudi riyals, leading the health transformation at R1 to achieve Vision 2030. Please, ladies and gentlemen, join me in giving a warm welcome to Dr. Saleh Abdullah Al-Tamimi, Chief Executive Officer, Riyadh First Health Cluster, Saudi Arabia. حياك دكتور، تفضل.
صباح الخير. شكرا على الدعوة. يمكن أنا لو أسأل أي واحد منكم عن أهم يمكن 5 صفات في الناس الناجحين، أنا واثق أنه معظمكم بيقول الإصرار. نفس الشيء ينطبق على المؤسسة الصحية، لأن المؤسسة الصحية أو أي مؤسسة هي عبارة عن مجموعة من الناس اللي عندهم إصرار عالي، عندهم مرونة عالية، يحطون أهدافهم ويسعون بكل ما يستطيعون أنهم يحققون أهدافهم. عشان كذا التوك حقتي اليوم مهمة على المستويين، على المستوى الشخصي في تنمية قدراتنا حنا، أو على مستوى الأورجنايزيشن itself. اليوم today I have these objectives is to define resilience. The resilience rules, barriers to resilience, and then closing the gaps. But what I really want to do is to have you think and reflect on your personal experience, your personal professional life, and your organization, and ask yourself, am I resilient? Is my organization resilient? And if not, then there is important work for you to do, because the world is changing very fast. So, Oxford Dictionary defines resilience as the ability of people or things to recover quickly after something unpleasant such as shock, injury, or etc. happens. And a resilient organization is the ability of an organization to anticipate, prepare for, respond and adapt to incremental change and sudden disruptions in order to survive and prosper. So it is not only a matter of prosperity, it is also a matter of survival. And the pandemic was the most clear example of how life and world can change within a day. So if we get something like the pandemic or the pandemic itself one more time, will we do better this time? We better be. But let's all agree that resilient organization cannot happen without a united, ambitious team and a good strategy. I can reflect on my personal experience, my personal successes and failures, is that one of the biggest things I don't see always in very smart people is that they don't have the resilience it takes to succeed more than others around. And I think it is something that we can develop in ourselves. إنه يكون عندنا إصرار عالي في تحقيق أهدافنا، وإننا ما نستسلم، وإننا ما ناخذ دور الضحية. لأنه بيكون سهل جدا إنك تجد أعذار لنفسك ولمؤسستك إنك ما تحقق الأهداف. لكن غيرك راح يحقق الأهداف. وهذا الفرق بين اثنين ممكن يكونون جالسين جنب بعض هنا في القاعة. نفس الظروف، نفس كل شيء، لكن واحد يقدر يحقق أهدافه، واحد ما يقدر يحقق أهدافه. أو مؤسسة تحقق أهدافها وأكثر، ومؤسسة ما تحقق أهدافها. So resilience also means understanding that life is full of challenges. While we cannot avoid many of these problems, we remain strong, confident, open, flexible, and willing to adapt to change. We have to understand that as leaders, we are diplomats. كل ما نكبر نصير دبلوماسيين أكثر وأكثر. نعتمد أكثر وأكثر على علاقاتنا. ما نعتمد على مهاراتنا الشخصية بس، نعتمد على collective power of people around us. So what are the characteristics of resilient people? They have a mental reservoir of strength that help deal well with stress and hardship. ما يكسرهم شيء. عندهم قدرة على التحمل ما هي عند أحد. يعرف إنه بيصير فيه مشاكل، بيصير فيه فشل، لكن هذا ما يهده. Face difficulties head on instead of failing in despair. التحديات يقابلها ما يقول أنا ضحية، هو لأنه كذا صار كذا، هي سببهم هم السبب. Problem solving skills، عنده قدرة على حل المشاكل. أنا كقائد ليش اختاروني قائد؟ لأني أستطيع أقود، أستطيع أحل المشاكل. إذا معظم الأحيان ما أقدر أحل المشاكل، إذا أنا ماني قائد أو أحتاج أتعلم. Strong social connections and network. It is all about the power of the team around you. You are as good as your team. You are as good as your results. You are not as good as your credentials. You are not as good as your CV. You are as good as your results. والresults المستمرة, sustainable results, does not come from one strong person. It comes from a strong team. إذن أنا حتى لو ما أفكر إلا بمصلحتي الشخصية، يجب أعرف أن فرص نجاحي أكبر شيء مع الفريق حقي، وإني أجمع الأقوياء حولي. Powerful leaders bring powerful people around them. Weak leaders bring weak yes men around them. They have a survivor mentality. They have strong emotional intelligence. ناس لطيفة. الناس تحب تشتغل معاها. ناس تحب انك تقودها. انها تقودك. Accepts failure and learn from it. وهذا الشيء مرة مهم في resilient people. إنهم they accept failure as part of life and they learn from failure and come out stronger.
2 minutes, Doctor, please.
Self-compassion is also important because this means I will also know when to take breaks. The resilient rules. What are the resilient rules? Speed and agility. أحقق أهدافي بسرعة. ما آخذ وقت طويل. I innovate. I try and think of new ways to solve my problems. I do all this innovation while ensuring ethical standards. I create or build a data culture and literacy. Then I'm a data-driven organization. I'm a data-driven person. That's extremely important. and curiosity. الفضول يا اخوان مهم في النجاح الشخصي، في النجاح المؤسساتي، وهذا يعني لازم ننمي البحث العلمي، وانت كقائد يجب تنمي البحث العلمي عندك في مؤسستك. There are of course barriers to resilient organization. And of course, and I put this in red, is when the leader is not resilient. إذا leader ما هو resilient, you're not going to get a resilient organization. And sometimes you will be faced with people you chose as leaders and you find that they are not resilient. You need to teach them. Give them a chance, but there has to be an end point. Bad organizational culture, skill set shortage, and notice that the top three are all people's, it's human reasons. It is not technology, it is not data, it's nothing. It is human people, human part. So the biggest barriers to resilience are leaders not being resilient, bad culture, skill set shortage, and notice that number 1 and 2 are both top down. Leaders create the culture. It is not the people who create the culture. It is you as a leader who you create the culture in your organization. Of course, when we don't have good data analytics, this is a barrier. Cost and cybersecurity risks are all barriers, but they are not as important as the top 3. In closing the gap, we have to, number 1, choose resilient leaders. Even if their CV is not as impressive as another person, or their credentials is not good, they did not study in the best universities, but they have a track record of success. Enhancing data analytics and security. I have to be ahead. I need to understand what's coming. Driving new technology innovations, improving sustainability practices, nurturing curiosity and research, and addressing supply chain complexity, which keeps coming. In closing the gaps, we have to prepare for unpredictable events, like the pandemic, strengthen business performance, restore technology functionality much more rapidly, and strengthen customer confidence and trust that the business is dependable. Finally, I want to say, change is tough. But if you're not changing, you're not growing. The world does not wait for us to feel ready. It thrusts itself on us at a moment's notice and forces us to change or suffer the consequences. Thank you very much.
Thank you very much, Dr. Saleh, for this valuable presentation. Just in 2 words, please. What's your opinion about the relationship between the leadership and the quality of care? In 2 words.
You cannot have good quality of care without good leadership.
Yes.
يعني عارف. There's no way.
You're right. Agree with you. Good. Thank you very much, Dr. Saleh, for this presentation, and hope to see you again, inshallah. Thank you very much. Thank you, Dr. Saleh. شكرا لك. يعطيك العافية. شكرا. Hello. Okay. With a prof of nanomedicine and pharmaceutical, editor-in-chief of the Saudi Pharmaceutical Journal, visiting professor at University of Alberta and National, S20 Future of Health Task Force Chairman 2020 G20. Institute for Nanotechnology, Canada, Saudi Arabia. Dean of Pharmacy College, King Saud University. Member of Saudi Commission for Health Specialists, and consultant at the Saudi Food and Drug Authority, and member of the Core Committee of Medicine Registration, Dean of King Abdullah Institute for Nanotechnology, Director of the Center of Excellence in Nanomedicine, and consultant and advisory council member, Saudi Standards, Metrology and Quality Organizations. Ladies and gentlemen, please join me in giving a warm welcome to Prof. Aus Shamsan, Secretary General, Saudi Commission for Health Specialists, Saudi Arabia. حياك دكتور.
يعطيك العافية. هذا كلكر. السلام عليكم. أسعد الله صباحكم جميعا. Good morning everyone. Thank you, Dr. Khalid, for this ceremonial introduction. I'm overwhelmed with what you have said so far. Thank you so much. Well, very glad to be here today. I want to share with you an experience that has been accumulating for a long time now, following up with the transformation that we are going through. And I'm very glad here to see among the audience my dear friend, the former Secretary General of the Saudi Commission for Health Specialties, because without the steps that he started and the build-up step by step with the digital transformation and the governance he initiated with his team, today I won't be able to come and talk to you about where we have reached and where we are going forward. So thank you very much, Dr. Ayman and your team, for what you have done. So, as everybody knows, 2030 is a transformational year for the globe. And like the Crown Prince said, the story of 2030 will be Saudi Arabia. And the health system is transforming along with everything that is transforming in our country toward reaching the vision 2030. And here you can see that the health transformation is moving in taking great strides in moving from being a disintegrated system to become an integrated system, system that was focusing on disease-centric, to population-centric. The patient will not be a recipient of the care, will be part of the care. And with this transformation, there is an important element. Ironically, transformation is contagious. And in health, it is here a positively contagious. The health system and the Saudi Commission in particular is transforming to be practitioner-centric and considering the practitioner as the heart of its transformation. And with this care, practitioners will be empowered, will have a say. The voice of clinicians is the voice of transformation in the Saudi Commission for Health Specialties. And you can see during the years, there is a change in the mindset. We are facing a new generation coming in the pipeline of health practitioners. And I can reflect on that from my previous experience as a dean in the college. I have seen generations changing. I can reflect on the first group that I taught after I came back and joined as a junior faculty, and the last group I taught when I was a dean before joining the Health Commission. You can see the change in mindset. This is the pipeline of healthcare practitioners. They have different set of needs. They have different demands. They need to be treated in a different way. They need to learn in a different way. They have different demands, and they need to practice in a different way. With this, the health system, being a changing and transforming health system, will require different set of skills. Probably, we will face new type of positions, new type of leadership styles that hasn't been there a decade ago. So listening to the voice of practitioner is very critical. So our current state now that we have a very good governing system, our regulations became carved and released. We are aligning now with the global picture of healthcare delivery and how we want our practitioner be represented and empowered. And this will not happen without a proper alignment with the strategic vision of transformation. And you can see this pattern repeating. With every organizational strategy, there is a clear map with the vision, with the sectoral strategy, and how this organization is positioned within the sector, and how it is cross-sectorally reacting with other sectors, wherever it is to provide its mandate. And the Saudi Commission is not an exception for this framework. Here, we are enabling the system through empowering practitioners. And I can confidently say that with the infrastructure we have, with the governance system we have, with the bylaws we created, and with the tools we invested in, we can apply now the concept of right touch regulation. And let me just give you a glimpse about this, this concept. We are attending the Global Health Exhibition under the slogan of Invest in Health. And the most important element in investing is to have a stable market and a predictable regulator. So regulators play a role in dictating how the market will behave. And regulation is not prevention, is not protection, it is regulation. So there is an area of up-regulating and down-regulating, over-regulating or under-regulating, depends on the minimum acceptable risk and depends on the market need. And this can be applied, this concept of right touch regulation can be applied in any regulated market. And you can consider healthcare delivery and health practitioner as part of this. So regulating healthcare professionals is extremely important, not to preclude them from providing the service, but to empower them. To empower them in terms of protecting their title. So there are no intruders to the field and claiming titles that don't belong to them. You are empowering them to provide the right service. You are empowering them by upskilling them, by providing more tools and techniques for them to deliver the service they are intended and trained to do. And with this, we are creating a regulator that can speak to the market, and the market will cherish investment in this way. This is an example, and if some of you have attended the session yesterday where Dr. Khalid al-Shaybani was speaking about the future of health care transformation through the health sector transformation plan program, we touched upon how we can apply AI in different businesses, including the regulatory arm of the Saudi Commission for Health Specialty. We invested a lot in this technology, and with the digital transformation that has been going through, we have been going through in the Saudi Commission for the last 6 years, we were able to reach a point where we can identify the hidden stories within the data that has been accumulated for the last 30 years, and utilizing these to help us in coming up with decisions, making our decisions informed by the power of AI. So we are moving now from an AI per se to a DI, decision intelligence tool. And this is one example. So we came up with a tool that can identify and predict the path, the regulatory path for an applicant, a candidate, to be registered as a member in the Saudi Commission with a 90% accuracy. And this helps a lot. It helps the operator to take the decision fast, with higher accuracy, with less risk, and this is empowering to the practitioner, him or herself. And this is how it looks like at the back end. So assume that you are an operator now, looking at a new registration application. You might find a tool that, like this, will help you, telling you that this is most likely will be registered as a specialist in this specialty, and most likely he or she needs to be examined. This decision can be done in seconds now with the power of the tool we created. Let alone that, with identifying the pattern and defining the risk that we associate through the right touch regulation program, we were able now to re-register members that are in our system automatically. And we applied this since July. More than 15,000 applicants used and benefited from this application. And you can see, I'm very happy to share with you that this was a result of listening to the voice of practitioners. We conducted a survey about a year ago, and one of the recommendations was manifested in this application. And you can see the time spent for re-registration reducing from an average of 16 hours to 30 seconds. Less than 2 minutes, as short as 30 seconds, you can get your product, your certificate re-registered. This helped in also saving the time for the operator to help and operate to process files that couldn't undergo this program. So the all-over, spillover effect led to an all-over reduction significantly in the re-registration time. This is just sharing some of the feedbacks that we hear from you about this new service that we have. And alhamdulillah, we are taking this as an encouragement to move forward to whatever we can do to empower the healthcare professionals, members of the Saudi Commission for Health Specialty. With this, we believe that healthcare transformation will only become reality if practitioners own the narrative. And this is why the Saudi Commission for Health Specialties exists, is to empower the professional, empower the healthcare practitioner. تهدف الهيئة إلى تطوير الأداء المهني الصحي، تعزيز وتنمية القدرات، إثراء الفكر العلمي والتفكير العملي والتطبيق العملي السليم في التخصصات الصحية كافة. هذا من نظام الهيئة. شكرا جزيلا لكم.
Thank you, Doctor, for this valuable presentation. Really, it's interesting that we saw something new done for the healthcare professionals toward the quality of healthcare. So, as you know now, there is a new model of care. In addition, for transformation of healthcare services, and one of the objectives of the Saudi vision is the quality, providing quality of healthcare services. Do you think that all these digitations and the new technology used for providing the care help the healthcare professional to improve the quality for of healthcare services to the patients?
Well, I think it's a very important question, and we can have debatable answers. But personally, I believe that all these tools would definitely help healthcare practitioners, but it will change the set of skills that are needed. And you can see this as a pattern with technology development. If you go back a generation before, you would see that this type of clinicians, or those clinicians, were more into physical examination, more into reaching diagnosis, without using any tools, because technologies were not existing at that time. Right. Today, or maybe in future generation, new doctors will rely a lot on AI in order to reach the right diagnosis or to carve a therapeutic plan. This is not scary, and we should not be scared of an AI. We should empower a practitioner that uses an AI, and this is where we have to stand. We were in one of the WhatsApp groups with health professionals, and they were talking about how ChatGPT is passing medical licensure exam recently, the American, the British, even the Saudi, with the other professional exams. So my reply was to this debate is that this exam, or ChatGPT, will not replace a doctor, but it shows the validity of the exam, that it's within the scope, and it will empower the doctor to focus on other skills that are needed and can be empowered by AI. And my answer was prepared by ChatGPT itself. So this is my answer to you.
Thank you very much, Doctor. Thank you. Any question, please? Any question from the audiences? Okay, Doctor. Thank you very much. Really appreciate your coming and hope to see you again. Thank you very much.
Thanks a lot.
Thank you. Appreciate it. Thank you. Okay. Now, with a director of King Saud University Liver Disease Research Center. Clinically, he has been a consultant of gastroenterology and hepatology at King Khalid University Hospital in Riyadh, as well as in King Faisal Specialist Hospital and Research Center as a part-time liver transplant hepatologist, and as well as private practice in multiple organizations. Prof. Ayman Abdo has a long and rich administrative experience both in the academic and medical fields. He has been the head of academic affairs in the College of Medicine at King Saud University, as well as the Vice Dean for Quality and Development between 2008 to 2012, and subsequently the Vice Dean for the Postgraduate Studies and Research between 2013 to 2016. Most recently, he has been the Secretary General of the Saudi Commission for Health Specialists from 2016 to 2022. Prof. Abdo has been a member of many health specialists from 2016 to 2022. Prof. Abdo has been a member of many health specialists and also including the National Education and Training Evaluation Commission, the Saudi Patient Safety Center, the Saudi Public Health Authority, and the Saudi Medical Council. In addition, he has been a founding member of the Pan-Arab Liver Transplant Society, founding member of the Saudi Association for the Study of the Liver, the treasurer and board member of the Saudi Association for Gastroenterology, and the editor-in-chief of the Saudi journal Gastroenterology. Prof. Abdo has more than 100 publications and peer-reviewed journals, hundreds of keynote speech and scientific presentations, all around the world. He has published books in Arabic and has been a regular writer in Saudi newspaper Al-Iqtisadiyya. Please, ladies and gentlemen, join me in giving a warm welcome to Prof. Ayman Abdo, Senior Vice President of Faqih Care Group, CEO, Dr. Sulaiman Faqih Hospital, Riyadh, Saudi Arabia. Thank you.
بسم الله الرحمن الرحيم. حياكم الله جميعا. I felt like a boxer or something. I was like كأنه تقديم ملاكم ولا شيء. بس حياكم الله جميعا ويعني سعيد جدا. In the wildest of my dreams, I never thought I would be presenting after the succeeding Secretary General. شكرا جزيلا على كلماتك اللطيفة وشكرا لكل الزملاء الضيوف. شكرا دكتور خالد على الاستضافة. And thank you for choosing me to represent the private sector. How many people here are from the private sector? The winners, the future is for us. Remember that. These are not my words. These are the words of the minister yesterday. He said that the private sector is going to grow from around 25% currently to around 50%. And the market share is going to go up from around 80 billion riyals today to around 350 billion riyals. So I encourage all of you to move to the private sector. The future is in the private sector. I'm just kidding, the future is in Saudi Arabia, wherever that is. As you know, there is a lot happening in Saudi Arabia, whether it is in the transformation program or in the reform that's happening. Right now, the private sector size is something around 80 billion riyals. This is contributed by out-of-pocket spending of around 25 billion and insurance-driven spending of around 30 billion, plus government-induced spending around 30 billion. But what's going to happen in the next 10 years is outstanding, and it's really interesting. You, as Dr. Saleh taught us now, can know the resilience of someone from looking at his past, looking at his track record. The track record of the private health sector is robust. You can see here there's at least 8% year-to-year growth in the private sector in the last 10 years. The margins are in around 10 to 15, sometimes up to 20 and more %. And so the market has been really, really growing significantly. So if we predict, this data is from CCHI, the current insured individuals in Saudi Arabia are around 11 million now, plus and give and take. By 2030, it's expected to go up to around 30 million individuals, 25 to 30 million. So at least doubling or maybe more of the private sector insured. The number of visitors of Saudi Arabia, currently around 9 million, is going to go up to around 30 million or more. This is a huge private sector opportunities. The amount of investment or the market share or the market capital is going to increase at least 3 to 4 times, including the contribution of the private sector healthcare to the GDP. This will reflect on the operational needs. So currently we have around 20,000 beds. That's going to go up to around 50 to 50,000 beds around 2030. The number of private clinics now are around 4,000, going to go up to around 10 to 12,000. And similarly in the pharmaceutical industry and in all the affiliated industries. Even beyond provision, an area that is close to the heart of Dr. Aus, the other industries are going to also grow. So the future is for the private healthcare, and a huge growth is anticipated. So when I'm asked to talk about quality in healthcare, Dr. Khalid, this is going to be an important problem, because unfortunately, most people look to quality in healthcare in the private sector like this. A lot of people still believe if you have a minor, small problem, you go to the private sector. If you have a real serious problem, you go to the government. Why? Because the quality in the private sector is inferior, is not as good. But my question today to you is that the truth? Is that really the case? And I'm arguing that it is not the case. If you look, for example, at the world's top 10 hospitals in the world, you'll see that many of them are private sector, at least the first 2. If you look at our region, you'll see that the first 6 hospitals in the Newsweek rank are governmental hospitals, while the 6th hospital is a private sector hospital, so competing between private and governmental sector. I borrowed this slide from my dear friend, Dr. Salim al-Wahabi. I'm not sure if he's going to be speaking today. I was very surprised. Out of 329 visits that Sibahi has done to governmental sector, the approval or the accreditation rate is around 54%. While of 152 visits to the private sector, the accreditation rate is 82%. I don't know if this is because there is more relation to billing and to governmental spending but there is more percentage of private sector hospitals that are accredited compared to governmental sector. I didn't know that before. If you look at even a lower level, the ESR, the essential standards required by Sabahi, you'll see a higher percentage of approval in the private sector compared to the governmental sector. So it's not true. It is a myth to say that the quality of care in the private sector in general is lower or inferior than the quality of the governmental sector. And so my premise today is to tell you and convince you and help understand together that private sector can and will and should be leaders in quality and patient safety, especially if they are going to be taking care of 50% of the healthcare in the future. And this is my premise. Good quality, good patient safety will lead to good patient experience. And patient experience is the most important outcome in healthcare that is related to so many other factors. Good quality and patient safety improves efficiency. And when you have improved efficiency and improved patient experience, you have improved revenues. And isn't this what the private sector is worried about? So people will say, come on, private sector is only worried about money, and they're looking for the margins, and they're looking for the net. They don't really care about quality or patient safety. But let's suppose that is the true. I'm trying to convince the investors here that if you really care about money, and even if you care only about money, you need to take care of quality and patient safety because the relationship is very direct. For example, if you look here at the factors that are affecting revenue, they are multiple, and the most important one is patient experience. These are a number of studies here, some in the States, some outside the States, that directly links the patient experience, quality of care, patient safety to revenue. If you have higher quality metrics, if you have patient-centered approach, if you have a better patient experience, very, very unanimously, you have better revenues and better net. And there are many reasons for that. One of them is that you have more return patients, more loyal patients, better brand, and patients start coming back to you. When we hear the names of the pioneer private sector brands, we go to them, we trust them. So that's related to quality and patient safety. Also, if you look at not only patient safety, but patient experience metrics, and you compare them with revenue and outcomes. This study, for example, shows with every 5-point improvement in this quality and patient experience scale, you have a 1% increment in profit. Direct head-to-head relationships. So if you're worried about your finances as a private sector investor, you better care about quality and patient safety because they are directly related. So when your patients are happy and they're sailing through a journey that is pleasant, that is safe, they trust the organization, it improves your revenues. This is a fascinating study comparing hospitals which took average or moderate or excellent scores in the patient experience surveys and revenue. Across almost like a meta-analysis, clearly shows significant effect on net and on return of investment. So I think I beat this point to death. There is a very, very close relationship between patient experience, quality of care, safety, and revenues. This will affect your brand and all your other factors. Now in Saudi Arabia, you all know, the more accreditations you get, the more likely you're going to be able to bill, and the higher your billing numbers can be, because we all know that accreditation, if done properly, and I'm stressing this point, accreditation, if done properly, will improve all the health metrics, will improve patient safety, and will improve outcomes. So more accreditations, more interesting quality, better payment from the government. But not any accreditation. So when you really do accreditation for the right reason, it's like anything else we do. Even salah, if you pray and your mind is somewhere else, it's not like when you pray when your mind is in the prayer. Also, if you look at value-based care, we're moving with huge speed now to value-based care. In value-based care, the importance of patient metrics and patient experience is even more important because we're going to be moving to patient-centered or patient driven outcomes. So if you're not convinced about this now, you will be convinced by force as we move on to value-based care and value-based billing. So this is something that we have to take care of, and we have to take care of it very seriously. So to summarize, if you have better quality, you have better patient experience, you have better efficiency. But let's talk one slide about efficiency. There's numerous studies that shows that accredited hospitals are more efficient than non-accredited. Hospitals who apply Six Sigma or whatever lean techniques are better in terms of outcomes and efficiency. This, for example, is a very interesting study that correlates application of Six Sigma or similar techniques with very significant outcomes of hospital outcomes, of patient outcomes. So you would think that this is just going to save money. It does actually improve outcomes, and we have gurus of healthcare administration here. So I think this is the summary. We need to do this, and we need to do it properly. We need to do it from our heart. We need to do it because we believe in it. And this segregation between private sector and governmental sector needs to stop, needs to end. We're all one system. We're going to be treating the same patients with the same standards, and so quality and patient safety metrics should be equal. Finally, I would like to share one slide from Faqir Care Group, where I work now, and you can see the flow of quality, revenue, side effects, and patient satisfaction, just as a proof of what I was saying. Faqir Care was the first private sector to get JCI accreditation in 2006, I think. And since then, you can see this yellow bars are revenue. I'm not going to show you how much money عشان الحسد تعرفوا. لكن you can see clearly that with more accreditation, with reduction in the percentage of serious side effects, with the improvement in the patient satisfaction, you can see that revenue goes up. This is real-time data. This is not data that is theoretical. So to conclude, I think that private hospitals should and must and are and will be leaders in quality and patient safety. And let me add one more thing. We can be leaders in many other things: research, innovation, health delivery, technologies, and other things. So started with the wise words of the minister, and will end with the wise words of the Vision 2030. Private sector is coming, and the future is for the private sector. شكرا جزيلا.
Thank you, Dr. Ayman, for this rich information about the role of private sector toward the quality and patient safety. Since we talk about patient experience, and this is maybe my major subject, what do you think if the top management of the hospital in general, especially in the private hospital, focusing and considering the patient experience as a journey toward patient satisfaction as an outcome, how this influence the effectiveness and efficiency of the hospitals toward achieving the quality and patient safety?
يعني I think Dr. Khalid is, as I showed in the talk, private care is healthcare is not different from any other type of care. So
Yes.
we are talking about a client-based interaction. If the clients have trust in the organization, if the clients have believe that you're going to come, you're going to be received welcomely, and you're going to get good care, and there is a very low chance that you will be harmed, patients will be loyal. Patients will be approving of this brand, and so they will be part of your success. A very nice experience is when patients and their families are also part of the decision making in the hospital. This gives another edge of healthcare. And so I think really this goes back to basic principles of marketing and basic principles of business, is that, you know, starting with the client. Isn't this the whole fame of Steve Jobs and Apple's, and starting with the client? How come in healthcare we just want to apply standards without really thinking about patients? So I think it's basic common sense principles of business and marketing.
Very good. So do you think that at the end, patient experience win?
No doubt. I think that's a fact.
Thank you very much. Thank you very much, Dr. Ayman, and hope to see you again. Thank you very much. Thank you. يعطيك العافية. شكرا. Okay. Now, with the Chief Executive Officer of the Public Health Authority, WCAIA. He holds a medical degree from King Saud University in Riyadh and the Saudi Board of Internal Medicine. Dr. Al-Gwizani completed a hospital epidemiology fellowship from the University of Iowa Healthcare and Clinic in United States and a Saudi fellowship in infectious disease with an honor degree. Dr. Al-Gwizani is a member of the board of directors of the Saudi Vision 2030 Health Sector's Transformation Vision Realization Program and a member of the board of directors International Association of National Public Health Institutions. Also, he is the senior focal point for Saudi Arabia in the global health security agenda and the antimicrobial resistance champion of Saudi Arabia in the G20. He also holds key leadership positions in several national committees and institutions for health and has represented the Kingdom of Saudi Arabia in the international forums and meetings. Ladies and gentlemen, please join me to give a warm welcome to Dr. Abdullah Al-Gwizani, Chief Executive Officer, Public Health Authority, Riyadh, Saudi Arabia. يعطيك العافية دكتور. تفضل يعطيك العافية.
What is the mic? Assalamu alaikum. Is this working? Work like this? Okay. حياكم الله جميعا. It's very tough to be followed Dr. Prof. Ayman. I think he's a wonderful presenter and for sure a great teacher, and he was a very important member of our board during the inception of WCAIA. So when I've been assigned for the role of public health and quality and of healthcare, actually I was in a thinking process with the team. How can we deliver the best talk in 10 minutes? And Public Health Authority has worked since its inception to improve the quality and patient safety during the pandemic, with regard for the direction and guidelines, and also for accrediting the labs for the COVID-19, which enhance the patient safety and quality. But in this area, we'll take something outside the pandemic. We go to the newborn screening as a project, which also has a great and important role in that. So before that, I would like to give you an input about the vision and mission and the value of the Public Health Authority. Our vision is for the nation health to be secure and thriving, and also to be mission is around the clock to protect and promote the public health and health security through integrated surveillance, effective intervention, and partnership, and continuous monitoring and evaluation. Our values are accountability, integrity, and trust, and proactiveness. So, and this is our strategy. We work on the three pillars: intelligence, intervention, and institutionalization. So why newborn screening? We build our strategy and our operational plan based on the national vision and also national indicators, with the target of improving the life expectancy. In Saudi Arabia, due to the marital culture and have a unique pattern of the incidence of the metabolic and newborn disease. It is estimated that to be 1 every 1,000 compared to the G20, which is sometimes range between from 4,000 to Japan 1 to 10,000. And most of these diseases, actually, the intervention, it can be easily picked and has impact on saving the life of the child or the baby. And for sure, it has impact on the life expectancy after all, if you save the baby at start. So Public Health Authority developed an improvement plan for each to ensure every newborn is screened for genetic disease in collaboration with our stakeholder, with the Ministry of Health and the private sector and other non-governmental or non-MOH governmental hospital. Newborn screening contribute to early detection and reduction of genetic metabolic disease, which will indicate increase in life expectancy, reduce the rate of illness and disability and mortality, and reduce the healthcare cost. So what we did, we start by two interventions, one with regard to regulatory intervention and the other for the IT and digital platforms. We started by issuing directive issue to all sectors to screen the newborn screening and provide the support in a timely manner and also interactive in every week. Protocol was issued to referring positive cases for confirming the cases to the public health authority and inform the stakeholder, and also ensuring the compliance of the private sector for this directive. In the digital form, we try to integrate and make the test for the newborn is mandatory, and we're working through these platforms to make it an easy and is not to be forgotten during the delivery. So we were at the start of this year. The national average is 63%, and our target this year to reach 100. So we managed to increase, with the help of the stakeholder, our rate from 63 to around 92 in the third quarter of 2023. The significant increase was as a result of this continuous and plan for improvement. However, we believe this is a great success, but need to be continued, and also we push for it to be sustainable. Our next step to reach 100% is to reaffirm the protocols and for confirmed cases. We will start by delivering community awareness protocols, and we'll review the new screening guidelines every now and then and make sure that it's adopted. Also for emergency delivery, that it's a gap, we are working to optimize it with the stakeholder, continuous training, and we will adopt research for disease in the next panel. Thank you very much.
Thank you, Dr. Abdullah, for this valuable presentation. Really, it was amazing that we found Waqaya as a part of the health system in Saudi Arabia. If we mention Waqaya, we go directly, from my point of view, public health. Is that right?
For sure. Yes.
Yes. Okay. So, the role of Waqaya nowadays and in the future toward achieving the quality of healthcare toward Saudi vision, which mentioned one of the objectives of the Saudi vision is providing the quality of care from the side of curative and preventive health care. So what is the role of Waqaya in the nowadays and in the future for providing the quality of care for the community in general and patient special?
Sure. So public health is wide in nature, and the beauty of public health is to work with the health sector or health provider, and also for non-health. And most of the social determinants of health reside outside the health. Adopting public health programs that will tackle the health and non-health with the mindset to improve and complement the health sector is our work. We work through people and with people to integrate their public health within the health sector, and also with program outside the health to make sure that there's other determinants of health that contribute to health is being addressed in a nice way and more scientific way to make sure that these are the intervention are based on the priorities, based on the burden of disease, and based on the national indicators and the target and goals for the Vision 2030.
Good. Thank you very much. Really, it's interesting. And can I ask you one more question, please, about the relationship between WHO, WCAIA, Ministry of Health?
Yes. Most of the health system, with the maturity of health system, they have their a distinct body for the public health, and we, luckily in the kingdom, we are one of the mature health system in the region, where we have a designated body that it has related to public health, and we are moving with the collaboration with the Ministry of Health and the WHO to adopt and collaborate. We in WCAIA, we are the collaborating center for MERS, and we contribute also through the surveillance for any early disease, especially detecting any new pathogen from emerging and new emerging, and also collaborating with them through preparing the plan, emergency plan for any potential pandemics. We enjoy and we practice our role as a scientific hub and regulatory body within the health ecosystem, and we continue to foster our work within our colleague within ecosystem health and non-health.
Thank you very much, Dr. Abdullah. Any question from the audiences? Okay, thank you very much, Dr. Abdullah, and hope to see you again. Thank you very much. Appreciate it. Thank you. Okay. Our speaker now is a consultant physician and healthcare leader with 15-year accumulative experience in areas related to establishing organizations, building working teams, enabling disruptive innovation, change management, health economics, and financing, as well as developing and managing the standards, bylaws, licensors requirement for the quality and safety of clinical practices across the board. Together with an ambitious team, has led several high-impact national-level healthcare initiatives, foremost of which is the creation of the Central Board for Accreditations of Health Institutions, SABAHI, the largest of its kind in the Middle East, with the mission of setting quality standards, field assessment, accreditation, and compliance monitoring for more than 18,000 public and private healthcare organizations operating today in Saudi Arabia. Ladies and gentlemen, please join me to give a warm welcome to Dr. Salim Al-Wahabi, Secretary General, Central Board for Accreditation of Health Institution, SABAHI. يعطيك العافية.
هذا اللي اضغطه؟
ايه مضبوط الظاهر يعني خلاص. ايوه.
بسم الله الرحمن الرحيم، السلام عليكم ورحمة الله. أول شيء أحب أشكر الأخ الدكتور خالد خضر على هذه الاستضافة، وأحب أشكركم أيضا على تشريفكم بالحضور. So thank you very much for being here. So again, my name is Salim Al-Wahabi, and as Dr. Khalid kindly said, my background is a physician surgeon, and then it happened that I was selected to be the Director General of the SABAHI, which is the Saudi Arabian National Healthcare Accreditation Agency. basically, for those who are not probably familiar with what is the mandate of SIBAHI, so in a nutshell, we put the standards for quality and safe healthcare in all public and private healthcare organizations working today in Saudi. So we are talking about probably 17 or 18,000 providers. And then we do field assessments and field surveys to make sure that those providers are actually in compliance with our standards. And we do this through an army of surveyors and assessors. As we speak, we have almost more than 500 surveyors working with us today, the majority of which are young Saudi males and females in different specialties. So we have physicians, pharmacists, nurses, facility engineers, lab specialists, and so on. So the reason why I'm here today is I've been asked by my colleague, Dr. Khaled, to present about the ESR, or the National Essential Safety Requirements. And basically, these are 20 standards among more than 600 plus standards for hospitals. And we've chosen those 20 because we believe that they impose a very high risk on the safety and life of patients as well as the medical staff. Some of them are pure clinical standards like PC26, which speaks about the DVT, the deep vein thrombosis, and how much the facility is ready. I mean, the hospital is ready in identifying and treating such a condition. Other clinical standards are talking about the qualifications of the anesthesia staff, the credentialing and privileging process inside the hospital, and so on. And some other standards are actually speaking about the fire safety and the safety against radiation and radiation leak. So we've chosen these 20 standards that we believe they are all basic and essential, and then we decided to do different surveys on these 20 standards alone. So we have screened all the 500 hospitals in Saudi Arabia, not only one time, but 5 times. And we started this project in 2016. So this year, 2023, we are going to do it for the 6th time. And we wanted to see what is the progress and how is the compliance of the Saudi hospitals, both public and private, is going to be as we go down the road. So as you can see, all of these standards are actually very dangerous and very essential standards. And it's not acceptable for any hospital to score anything but 100% compliance. So last year, 2022, these are the results of all hospitals in Saudi Arabia. So about 63%, that's about 2/3 of the Saudi hospitals are or were in the green zone. And green zone means that all the 20 standards are met. But we still have about 30% in the yellow zone, which means that the hospital might have 1, 2, or up to 5 standards not met. And about 6.6% are still actually in the red zone, which means that they have more than 5 standards not yet met. But if you compare the results over the last 5 years since we started this up until last year, you can easily notice that when we started the ESR program in 2016, the majority of the Saudi hospitals were in the red zone. So almost 66.7% were actually in the red zone. And only 9.6% were in the green zone. And most of them were actually big hospitals with enough resources. And then as we go down the road, you can see that the percentage of the hospitals in the green zone is increasing. So we started by 9.6%. Next year, it was up to 16.8%, 30%, 48.9%, and then last year it was 63.4%. And again, the hospitals in the yellow area was also increasing in size. And the good news is that the red zone was also declining from 66.7 5 years ago down to 6% nearly in 2022. If you want to compare which sector was superior to the other sectors, then the private sector, the private hospitals, about 155 hospitals, scored the highest in the green zone. So 81% of the private hospitals were actually in the green zone last year. And Ministry of Health, almost 50% of their hospitals, almost 270 hospitals, were actually in the green zone, while the rest were either in the yellow or in the red zone. Now, if someone wants to know what was the best standard and what was the least compliant standard, then the standard with the least compliance, when we started 5 years ago or 6 years ago, it was الجلطات الوريدية أو deep vein thrombosis. So when we started in 2016, the percentage of hospitals that were in compliance with this standard was actually 15 or 16%. But this differed during the year. So next year, the least compliant standard كانت FMS 22 اللي هي نظم إطفاء الحريق. The same for 2018, the same for 2019, and last year, the least standard was actually FMS 21, which is about fire detection standard. The standard with the highest score or highest compliance, when we started 5 years ago, it was the qualifications of the anesthesia staff. And then it was, and the years after, it was infection control committee. But for the last 2 cycles, the best standards in terms of compliance was actually safety against radiation. This graph here tells you about the national average of compliance for all the standards across the kingdom. And as you can see here, the gray bar was actually the compliance rate in 2016. And the green bar is the compliance last year. And as you can see, most of the 20 standards are actually in the 90% zone of compliance, which is a very good news for the patients. So that was, in a nutshell, a brief note about the ESR program. So in conclusion, this is a mandatory program that we will be continuing doing it this year and next year. And we will be expanding the number of ESRs. So there will be more than 20 ESRs in the coming years. And these are one of the achievements that we are proud of, because if you take one standard as an example, standard DVT standard الجلطات الوريدية. Let me speak in Arabic. لكم أن تتخيلوا مثلا أنه عام 2016 لما بدأنا هذا البرنامج كان المعيار الخاص بالجلطات الوريدية العميقة ومدى استعداد المستشفى لاكتشافها والتعامل معها فيما بعد، كانت نسبة المستشفيات اللي طبقت هذا المعيار 16% بس، 16%. Last year البرسنتج كان تقريبا 90%. فصارت المستشفيات عندها على الأقل screening methodology لهالحالة وتقدر تتعامل معها، وصار أطباء الطوارئ على الأقل يعرفون ما هي هذه الحالة. وأنا كجراح مرت علي قصص كثير لسيدات شابات كانوا يدخلون للطوارئ ما كنا نعرف شيء عن الدي في تي، وكانوا للأسف يدخلون وهم عندهم جلطات يعني هيدن متخبية يعني في الأوردة العميقة، وبعدين نعمل لهم عملية جراحية whatever it is، زايدة دودية ولا استئصال مرارة، وفجأة المريض يموت على طاولة العمليات ما نعرف إيش فيه. ثم نكتشف فيما بعد أنها جلطة رئوية انتقلت من الأوردة العميقة في الساق. فهذا المعيار مثلا يعني يبدو معيار سهل، ويفترض انه it's very obvious انه المفروض الكل يعرف، لكن في الحقيقة it's not true. لما رحنا وزرنا المستشفيات، معظم المستشفيات ما كان عندها آلية معينة ولا سياسة ولا طريقة للتعامل مع هذه الحالات. اليوم الحمد لله احنا نتكلم في معظم المستشفيات صارت على الأقل عندها فكرة جيدة عن هذه الحالة، وقس عليها الأشياء الأخرى. التسرب الإشعاعي، كم واحد يعرف اليوم إذا راح يعمل أشعة ولا يعمل سيتي سكان، ولا سيدة رايحة تعمل ماموجرام، ما تعرف هل في تسرب للإشعاع من داخل غرف الأشعة في هذا المستشفى ولا لا. هذا التسرب يضر العاملين ويضر المرضى أيضا، ويؤدي إلى حدوث سرطان في مراحل متأخرة. أيضا هذا المعيار كان من المعايير اللي مستوى الالتزام فيها في البداية عام 2016 كان قليل، لأنه ما كان في ترصيص جيد للجدران وعزل للمواد الإشعاعية ما تطلع وأشياء أخرى. اليوم الحمد لله هذا المعيار almost 90%. فكثير مستشفيات صرفت يعني مبالغ طائلة، وبعضها زي وزارة الصحة صرفت مئات الملايين علشان تتطابق مع المعايير ال20 هذه. وأنا أقولها من منطلق أني أنا عارف كم صرفوا، وعارف أنا ما أتكلم على 10 ولا 20، ولا صرفوا مئات الملايين علشان يخلون مستشفيات الوزارة ملبية لهذه المعايير. فهو مجهود جماعي، وإن شاء الله القادم أفضل. أنا آسف على الإطالة وشكرا جزيلا.
Thank you, Dr. Salim, for this rich information about Sabahi and about the hospitals who got the accreditations from the side of government or private hospitals. ESR is a national essential safety requirements, including 20 standards. And I know that these standards is working to enhance the quality of healthcare services and patient safety in most of the health institutions. Sabahi, in future, is there any plan to increase these 20 standards for ESR?
Okay, thank you for the question. Yes, the answer is yes. We will be increasing the number of the essential standards. So it will be more in number and it will be more in complexity. فراح نستمر في تقييم ال20 معيار إلا إذا تجاوزت نسبة الالتزام في 95% and above. في هالحالة سنتوقف عن تقييم المعيار هذا ونستبدله بمعيار آخر. بس as long as in the national compliance rate أقل من 95 راح نستمر. So yes, إن شاء الله السنة القادمة 2024 راح نطلق ال ESR Plus اللي هو معايير براءة المتطلبات الأساسية الأكبر اللي حيكون فيه أكثر من 20 معيار.
Good. How this will align with the international standards like JCI, like Canadian, Australian JCI? How Sabahi aligned, and how Sabahi will in future be a big institutions in the region to provide quality standards for all the private and health sector institutions?
والله أنا أعتقد عملنا وعمل JCI الأمريكية أو Accreditation كندا الكندية، أعتقد نحن نكمل بعض، والمعايير سواء الأمريكية أو السعودية يعني in its core are actually the same. So it's the same principle, and they will all add value if they are properly applied in any healthcare organization. So I can see the mandate of Sabahi and what other international accreditation agencies in the region are doing is actually complementing each other. في السنتين القادمة 2024 2025 راح نطلق أكثر من 19 أو 20 برنامج معايير جديدة.
ما شاء الله.
غير البرامج المعايير الحالية. حاليا سباهي يقيم مستشفيات، يقيم المختبرات الطبية، ويقيم مراكز الرعايه الصحيه الاوليه، لكن سون حنقيم مراكز الاخصاب، مراكز العلاج الطبيعي، مراكز الصحه النفسيه، مراكز الطب الاتصالي، مراكز السمنه المفرطه، مراكز طب الاسنان اطلقنا معاييرها مؤخرا. So in the next 2 years or so there will be 19 new standard programs. So I think if we do it this way, we will be covering all healthcare providers in Saudi today.
Very good, really good question. Thank you very much, Dr. Salim. Any question from the audiences, please? Yes, please. Yeah.
Hello. Dr. Salim, since most of the hospitals have been anticipating the release of the fourth edition standards for hospitals, I want to ask, the first question is, the draft that was released about a year or 2 years ago, does it include all of the standards that are going to be released? Was it only a section of the standards? The second question is about the ESR.
أنا ما أسمع. صوت بس ممكن صوت شوي.
My question is regarding the fourth edition of the hospital standards. You were released a draft 1 or 2 years ago.
No, that was just a draft. It's not the final version.
Okay. The second question is, since you just mentioned that there is going to be an addition to the ESR standard, when you mentioned that it's more than 95%, are you talking about a national 95% for the standard or specific to each hospital?
The national average of compliance.
Okay, and since for each hospital it's still going to remain that the ESR visits are going to be annual and reaccreditation is going to be every 3 years.
Yes.
Type for hospitals that are due for reaccreditation next year, 2024, is there any way to know if we are going to be audited on the third edition or the fourth edition? Is there an approximation of the release date for the fourth edition?
On the current third edition.
Thank you.
Thank you. Technical questions. I think you are working in a hospital. Thank you very much. Thank you, Dr. Salim, for your coming, and hope to see you and join with us again. Thank you very much. Thank you very much all. We have finished the first session of our forum about the quality in healthcare services. See you, inshallah, after prayer and lunch at 12:50, inshallah. Thank you very much. See you. 12:50, yes. 50. Huh? 50. 12:50. Thank you very much. Huh? ما اسمع. يعني بعد ساعة. Yes, okay, sorry. Yes, sorry. Okay. 1:50, sorry. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back all. Thank you for your commitment to participate in this conference, and hope at the end enjoy your. Okay, let's start to introducing the moderator of the second session of this forum, Professor Fahad Al-Bujaydi. He is a highly distinguished academician in healthcare profession with a prominent career in the field of healthcare management and quality assurance. He earned his doctorate from Faculty of Medicine, Nursing and Health Sciences, Monash University. Dr. Fahad is a visionary leader during his period as a dean. Healthcare research, education, and institution made substantial progress. He is also director of Saudi Society for Quality, where he has contributed his fundamental role in overseeing the strategic management in healthcare institutions. Let's welcome Dr. Fahad Al-Bujaydi. Dr. Fahad, please, you are welcome.
It's not working. Yeah, is it okay now? Assalamu alaikum wa rahmatullahi wa barakatuh. You are welcome back. I hope you have enjoyed your lunch break. And now, in this session, we have two great speakers who will focus on a very critical areas. So we will be soon with Dr. Ali Asiri. Dr. Ali Asiri is working as a consultant in pediatric. Also, he is the Director General of the Saudi Patient Safety Center since 2023. He did his specialty and training in pediatric in Albert Children's Hospital in 2008. He will talk today about transforming patient safety, and he will emphasize on the role of the leadership. Please, Dr. Ali. Welcome, Dr.
Bismillah ar-Rahman ar-Rahim. Good afternoon, dear colleagues. It's a pleasure to be here today with you to talk about an important issue that we all focus on. And before that, I'd like to thank the organizing committee and scientific committee for the opportunity to chat with you about patient safety. Let me start with a patient story. Our patient today is Faris. Faris is a previously healthy 2-year-old boy. He came with gastroenteritis to the hospital, found to have dehydration and hypokalemia, planned to receive IV fluids and potassium supplement. Shortly after starting the infusion, he had a convulsion and arrested. Then he was coded, CPR initiated, but did not respond, unfortunately, and he was announced dead, unfortunately. That is a sad story. He was found to have received 10 times the dose of potassium that he should have received. Probably you have heard about similar incidents or not, I'm not sure, but this is something that we have to live with. The challenge is how to reduce the, can you check the screen, please? How to deal with this tragedy and try to prevent it. There's a role for leaders, and there's a role for everybody in healthcare to make sure that this will not happen again. So what do patients want from us? They want safe care. They want to keep them, they want us to expect from us to keep them safe. They want us to use our clinical effectiveness and knowledge and skills, They want us to be nice to them. They want to have a good experience when they deal with us, communicate well with them, respect them, give them the opportunity to talk and express their concerns. However, the question is, are we delivering that? Are we really doing that or not? This is a famous report that has been released in 1999, which was the first alarm to the healthcare system globally that there is a problem with patient safety. Up to 100,000 patients die every year in the US because of medical errors. Up to $30 billion are lost due to adverse events. Up to 7,000 patients die every year because of medication errors. Alarming numbers, concerning statistics. However, after a lot of efforts since 1999, still in 2016, there is deaths due to medical errors is the third most common cause of death in US. So we are not really progressing. 2021, a report has shown still that 1 in 10 patients is subject to an adverse event across the journey of care. 134 million adverse events due to unsafe care occurs in hospitals globally, and around 3 million deaths every year happens due to healthcare. This translates into 1 death every 5 minutes globally. Still, although people, systems realize that our care is unsafe, a lot of efforts has been done, but still we are not getting the desired target. Why? Probably we need leadership. We need a mind shift. We need transformation in our way of provision of care. I'm not sure if the pointer will work or not, but this is a very important concept that's related to leadership. If we focus as healthcare systems, healthcare providers, healthcare leaders, on the sharp end, on the nurse who gave the medication, and the doctor who wrote the prescription, and we forgot the whole system behind it, we will not achieve much. And unfortunately, this is what has been happening so far. Blame culture. We caught the nurse who did that, gave that injection, or the doctor who wrote that prescription. But we don't think about why that has happened. Because of shortage in the number, because of stress that provider is going through, because there is no policy of procedures. There is no safe practice in general. So this is what I want to focus on. We need to make sure that our practice is safe from system point of view, which is the broad end, to the sharp end, which is the provider, and not to focus only in the sharp end, because this is what has been happening. And as I showed you in the numbers, we are not really achieving much. So we are talking about change. It's not a simple change, it's a major change that happened at different levels. System level, like the ministry, organizational level, like hospitals, big hospitals, facility level, service unit, till the individual level. So this is the microsystem. Microsystem, this is the vertical part. The same, we need to do horizontal change. In each block, we need to do structure change. We need to create structures that will support patient safety. We need to do policies and procedures and guidelines, and so on. We need to measure. We need to create culture. So unless we do vertical across all levels, horizontal, addressing all the needs, we will not achieve much. So what we are talking about is transformation. It's not only pockets of change here and there. We need to do a real transformation in the way that we deliver care and we address patient safety matters. Here comes the role of the leadership, because we need to talk on or address the culture part, which is the people aspect of the change, and we need to work on the technical aspect of a change. If you just concentrate on the policies, procedures, technology, and you forget the people aspect, you will not achieve much. So we need to keep the balance as a leader between both. So leadership is the key to improving and influencing patient safety. Leadership is an action, not a position. And it's an influence. How much you influence the business, how much you influence makes you a leader, not only the piece of paper that you have as a director or CEO or so on. This is a good representation. Patient is in the middle, surrounded by the immediate team, doctors, nurses, then like the other circle, like lab and others, then the admin part supporting them. Each one of them has an important role. Each one of them has an important role. It's not like how close you are to the patient, it means you have influence. No. Everyone in the healthcare system is a leader in the situation that he's leading. So there's system-level leadership, like ministers, board directors, all the way to the unit heads and shift in charge. Across all leaders, each one has a role. So it means everyone here has a role to improve patient safety. So it's not only leaders, we look into the CEO or the facility director. Each one has a role to improve patient safety. This will emphasize the point of blunt end, which is the organizational factors, culture, policies, procedures, till the sharp end, which is the healthcare providers and the hospitals. So transformation is to transform around the user, around the patient, listen to the patient, get their needs, listen to their voice. And we need mind shift, because whatever we have been doing before, whatever we have been doing like a blame culture, focusing only on the end, sharp end, will not lead us to improvement. So we need a new future. And this is what is happening in the country now. We have been listening or hearing transformation. This is exactly what we need to do. And to do that, we need a transformational leadership. We need directors. We need like a managers, but still we need somebody who will lead the people, who will support them, who will empower them and take them to the next level. To do that, we need across the system change, which include strategy, structures, processes, people and culture, and technology. We need to keep the balance and not to focus in one thing and keep the other one. So we need a strategy, we need a change-receptive culture, we need data management. These are the major three components. So what to do? Quickly, I'm aware of time, so I'll try to go quickly through the steps, and please focus with me on those, like 8 items. And I understand that there are different levels of maturity. So probably you will find something that fits you as a person or your organization, and something that you have been already doing it. So take whatever, this is the recipe, take whatever you think fits your needs at this stage, and the size of your organization and your business. So you need to address strategic priorities, culture, and infrastructure, engage key stakeholders, communicate and build awareness, establish, oversee, and communicate system-level aims, track and measure performance, support staff and patients' families, align system-wide activities and incentives, redesign systems, and improve reliability. We'll go quickly through each one of them. So to address priorities, you need to make patient safety as a strategic priority. And this needs, we need to have it in all policies, in all procedures. We have to talk about it in all our meetings, at the board level, at the organizational level. People need to know that this is our focus. Then we need to assess organizational culture. There are different measures that you could use to assess your organizational culture and understand the positives and build on them, and what do we need to improve on our culture to address it and make sure that we are addressing the culture issue. As I said, this is the people aspect of a change, and it's as important as the technical aspect of change. Establish, as I said, the culture that supports patient safety, address infrastructure. Like sometimes you need technology, you need reporting system, you need like any other enabler to make sure that you are addressing patient safety. Then learn about patient safety and methods of improvement. Knowledge is important. To know what, this is really vital. So we have different levels. We have from variable care, and this is something that we don't want to have. Patients are treated different ways in the hospital. There are no standards. There is no way that the patient, or clear way that this patient is being treated in that facility, because things are not under high quality or patient or safety standards. Till high reliable care, which is the ultimate goal. However, it is a journey. So you need to move along from here till this side. It is a journey, but you need to start it well, and you need to plan it well. So you need to measure your culture and understand your organizational culture. Where does it lie? Is it a very low in terms of culture, processes, technology, or is it high, you are reaching high reliability? There is no over-the-counter solution. There is no sort of ready-made solution. You need to understand your culture and the organization and then build your strategies and improvements based on what you have in your organization. Yes, you can utilize the experience of others, but still you need to customize your solutions to your culture and your organizational needs. Engage key stakeholders. So engage the board, the governance. Unless the support comes from the highest governing body, like the board, the CEO, you will not move much. So engage physicians, engage staff, engage and empower patient families. Every stakeholder will be touched by, we agreed on 20 minutes, so still have, we agreed, okay, sure, okay. So you need, everybody will be impacted the policy by this practice. So you need to address or engage everybody. Communicate and build awareness. So you need visibility. The leader should not stay in the office and just release memos or request people to do something. He needs to show people that I am really believing in this. I'm doing it myself. I'm going to the field. I'm doing a leadership round. I'm listening to patients, to staff, to improve. Implement safety briefings and other strategies to show visibility. Establish, oversee, and communicate system-level aims. You need to link people to high level. It's not only short-term gains. You need to connect them to a higher aim to improve patient safety in the organization. You need to measure the harm, measure errors, measure all the aspects of incidents in patient safety to improve and plan the improvement aspect. This is an example of measurement we do in the Patient Safety Center of Culture annually. Now we reached the 5th cycle, and these are numbers. Still, people, about less than 40%, they feel the culture is just. So more than 60%, they feel they are being punished. They are being treated, punished because of errors that probably they are not the reason for those errors. Step 6, support staff and patient families impacted by like the second victim program. Make sure that you support them. You support the staff also who were involved. Step 7, align system-wide activities. Alignment is very important. All the administrations and align your organization with similar organizations doing the same efforts, and redesign systems, care processes, make it more efficient, make it more patient focused. So these are quickly the steps. I'll just run because of time quickly. So instead of doing a reactive approach, which is that line, you will not take yourself much. You need to do the strategic, you need both, but you need to have strategic approach so you could sustain the changes. It is more difficult, but it is more sustainable with time. Is it easy to change? No. Change is hard. People will resist. So we have to understand that. This is why engagement is important. Knowledge sharing is important. Sharing data is important. And 70% of change failures are due to organizational change. So you need to be aware of those possibilities, and it is people aspect, resistance. So this is why you need to engage people at the early stage. In 2 slides, I'll talk about the Patient Safety Center. So the Patient Safety Center, it was established in 2017. It is one of the regulators in the healthcare system. It is sitting there with the SIBAHI, the SFDA, Minister of Health, the Saudi Commission for Specialties, CCHI, to regulate the patient safety center, to regulate patient safety in the country in collaboration with other colleagues and organizations. We have a mandate that gives us sort of regulatory work, operational to some extent, legislative. So we have really wide scope of action to work on eliminating preventable harm in healthcare in Saudi Arabia. So the commitment, as I said, and this is before the last slide, don't harm me, keep me safe, hail me, apply your skills and competence, be nice to me, which is the patient experience. Let's move from we can do it to we will do it. Let's commit ourselves to this. Let's go from this hall today, please, with a commitment that within my role as healthcare provider, as healthcare shift in charge, as anybody who's in healthcare, admin, I will do within my capacity a change that will help to achieve patient safety long term. Takeaway messages, measure and monitor. If you cannot measure, if you don't measure, you cannot improve. Strategize, prioritize, and customize to your organization, to your healthcare system. Align always within and outside your organization. Build culture. These are the features of patient safety culture. Just culture, learning culture, transparent. We don't hide because I'm afraid to report. Incentivize. Create sort of incentives for those who are adhering to patient safety. Engage and empower patient and family. Get them on your side. Listen to their voice. Care for staff well-being. If you have healthy staff, if you have staff who are safe, you will have care and patients who are safe. Allocate adequate resources and use technology to improve. Thank you very much.
Is it open? Okay. Shukran, Doctor. Thank you so much. We will just, I need only, thank you so much. In one sentence, just tell us how we will keep our patient safe, because this is what we are looking for. Here, the gathering is looking for this point. Within one sentence, of course, beside what we have learned from you now, we want to listen for 1 minute, please.
Sure. Thank you very much, Doctor. It's easy. It's not easy to say everything in one sentence, but I would say belief in patient safety and work as a member in the team. I think this in my view, we have to believe in it, its importance, its impact on us, on patients, and then work within our capacity to achieve that goal.
Thank you. Thank you so much.
You are welcome.
Of course, we would like to say thank you. And really,
welcome.
because we have a
Sure, I
short
understand.
time.
Thank
so
you.
next time, inshallah, we'll have
Sure.
more time.
Thank you very much.
Thank you so much, Doctor. Now, we will be with our second speaker. And of course, we will talk about visiting doctor program in the Saudi Ministry of Health, development and outputs. And our speaker will be Faisal, Dr. Faisal Salim al-Dahmashi. He is the Assistant Deputy Minister for Hospital Services at the Ministry of Health. He has an experience more than 17 years working in health sector. Definitely, he is currently member of many boards serving in this country, the Board of Directorate of the Authority for Care, and also for people with disability. Also, there is another board. He's a member which is very important, the Board of Directorate of Medical Referral Center. Dr. Faisal al-Dahmashi has his specialty in rehabilitation from Cardiff University. Could you please, Dr. Faisal, join us?
السلام عليكم. أسعد الله مساكم بكل خير. أشكر في البداية اللجان التنظيمية على الدعوة الكريمة، وأشكر الحضور جميعا لحضوركم لهذه الجلسة المهمة والتي تحدث فيها الدكتور مشكورا عن سلامة المرضى. And I'm here to talk about one of the programs that we have at the Ministry of Health. My presentation today will concentrate on visiting doctoral program, development, reform, and output. Let me please, first of all, I would like to elaborate more about our vision 2030. From the middle of 2016, we start looking to the future through a vision 2030. Our vision relies on three main pillars: vibrant society, مجتمع حيوي; a thriving economy, تصادم مزهر; وأن ambitious nation وطن طموح. The three main pillars that our vision rely on them, we have hundreds of KPIs and initiatives and projects toward those three main pillars. Today, I'm going to concentrate more on the three main strategic objectives. We should easing the access to the healthcare service. We should make sure that the services that we deliver in a very high quality, as well as we should prevent the disease. We should be strengthening our preventive domain. Those are the three main strategic objectives. I'm going to concentrate on them in my talk today. I'm pretty sure that you are familiar with those KPIs, initiatives, and applications. You know موعد, the central appointment system. Every single one of you here used موعد, because we are talking about more than 100 million موعد or appointment already booked. Do you think موعد by chance? No, it was planned. It was started from 2016 that we should make sure that the patient get to his doctor or his experts in a very speedy manner and in a way that if she or he doesn't need to come to the hospital to book an appointment, the application would help him. This is the موعد program. صحتي. صحتي now, if you open your application to صحتي, you will see who is your doctor, who is your nurse at the primary health care. Those systems, it wasn't by chance, it was planned, it was like a project, ended up with every single one here in Saudi, used it, see it, and even sometimes give a recommendation to improve it. 937, we received the millions of calls since that time. We hear the voice of the patient and the customer through an application or a system called 937, the call center for the Ministry of Health. ADA, which is a performance monitoring system, started since that time, and now we know every single patient in our departments, in the ER department, or even in the OR rooms. We know their productivity, we know number of patients, their status, based on one of the program called ADA. عش بصحة, live safely and healthy. It's a مبادرة, it's an initiative that every single citizen in this country know what is the عش بصحة, because it is there in the application, in the social media. If you go and you search it, you will see a lot of advisors, comments, advisors for the patient to make sure that the patient get the right healthy source of data from the right personnel. National Command Center, where we see 90 screens nowadays at the Ministry of Health just to make sure that we monitor the health service at the kingdom. EOC, which is the platform actually talking about the capacity, and we remember during COVID era when we expanded our healthcare system based on a platform that monitor every single bed at the kingdom. A center of referral and appointment. Those are the initiatives. They are transformational initiatives. They're not by chance. They started from the early of our vision, and now it's a fact. Today, I will concentrate on one of the programs called Visitors. If you are a hospital director or a leader in the cluster or a region, what do you do if you have a shortage in one of the specialties? How can you find the right specialty at the right time? And how can you deal with this specialty to bridge a gap and to make sure that you enhance the care that you deliver and to ease the service that you are taking care of? Visitor, it's an application. All doctors and experts, they are invited to register in the platform called Visitors. Nowadays, we have more than 20,000 experts signed, registered, available, and ready to be contacted at any time from any region to support during a short period of time. Governance, we started at the Ministry of Health in 2016. We started to make sure that the provider know exactly how to use the application, what are the manual, what are the standard, to make sure that we use the program efficiently and to make sure that if I need a doctor or expert, I can reach to him immediately. We launched the program 2016, and we are synchronized with Saudi Commission for Health Specialty. So if you are a doctor or a nurse or any practitioner signed there, I can fetch your data immediately by visitor application. As well as every hospital director now has access to the application. He can search, he can find whoever they want from the database, contact directly between the provider and the physician. Deal will come directly through the application or the platform. And we do have a central committee that will monitor between regions to make sure that the fund is there and the hospital or the leader of the hospital can easily sign a contract immediately with the doctor to make sure that the doctor will work. He is privileged, he has a contract, has the rights to work and to receive patients and to make sure that he will deliver a care within the hospital policy and procedures. In this curve, we can see that the program started 2011, but the reform actually with the Ministry of Health started 2016, at the end of 2016. You see between 2014 and 15, where we Merscope there, see the number of contracts or the number of doctors increased above the average. So it's a program that would support the health service during the pandemics or during the abnormal status for the healthcare delivery. 2016, end of 2016, Ministry of Health started to reform the program to make sure that we use the digital, to make sure that we ease reaching to the doctors, to make sure that we make sure every single doctor signed there, he has a qualification and he is already qualified from the Saudi Health Commission for Health Specialties. During 17, 18, start collecting more doctors. At that time, they were having only less than 1,000 doctors signed or registered in the database. And now see 2020, where the pandemic, COVID, Corona started March 2020. See the up-curving now that we used the program to make sure that we ease access to the service by having a doctor, expert doctor, and qualified, and they know what to do inside the hospital, as well as to make sure that the quality that we deliver, even during the pandemic, is in an excellent status. So we use the doctors that time. Until today, we are above average of number of doctors, since the systems now needing the doctors because we are expanding our service more and more. Who are the beneficiaries from the visitors program? These are the list, but they are not limited to these ones. All Ministry of Health hospitals, 288 hospitals used and rely on visitors to bridge a gap and to make sure that the service they are delivered in their hospitals will be monitored by other doctors or other specialties. صحة hospital, المستشفى الافتراضي. You are familiar of المستشفى الافتراضي? 100% of the مستشفى الافتراضي or صحة hospital operated by visitor program. 1937, which is the life-threatening or life-saving line where we have doctors 24 hours working and receiving calls from all zones and from all cities. It's already operated, and one of the beneficiaries from the program, life-saving line. National Command Center, quality and safety. Dr. Ali was mentioning about the safety, how can we improve the safety of our patients. We need experts to sometimes to evaluate and re-evaluate the process inside our hospitals. specialty leaders at the Ministry of Health, EOC, the Catastrophe and Disaster Management Department. So those are the list of beneficiaries from تطبيق زائرون. Where does the visitor work? You can use this program to support your outpatient, OR rooms, cath, expertise, virtually. You can use the application to support any gap that you have in your system. Those are the lists, but not limited to the areas that the visitors support, the healthcare system. As well as we do have visiting team, not a matter of only doctor. Team will move and mobilize to reduce the movement of the patient. So we try at the Ministry of Health to move the specialty toward the patient, not vice versa. We try not to move patient toward the specialty. Such program support and moving the full specialty toward the patient to make sure that the service will deliver to the patient as fixed in his city or neighborhood. During COVID, the visitor actually plays a very robust role to improve and to support our healthcare system. We increased the ICU beds up to, we reached to 10,300 beds all over the kingdom. We use the visitor program to support the healthcare system, and we use them even to initiate the protocol and to re-evaluate the protocol and update the protocols of treatment. We increase even the backlog, waiting list of the patients. We use the visitors and the surgeons to make sure that our system actually dealing with the backlog and long waiting list after the COVID by using such a program. Statistics, we concentrate now on the part-time, not on the locum. So if if I'm a hospital director, I need a cardiac surgeon for 2-3 days, I don't need to have him a full month. So we concentrate on the partial contracting program or model, which is a التعاقد المؤقت. And if I need him in a full month, I can sign a contract in his annual holiday so he can support other region. As you see, the specialties, we concentrate on the ER and the critical care specialties, since we are having a shortage of our hospitals. So if you see the list of specialties, yes, ER physician on the top, but still we have ICU consultants, we have ECMO doctors that actually supported our patient during the pandemic. This is our OR productivity. Now we produce more than 8,000 elective surgery a week. Try to imagine that, how huge is our system. 8,600 elective, not emergency OR. So visitors or a visitor program supported our hospitals to reach to this target. ER visits, now we are seeing around 12 million visits in the ER departments. Such system actually need support from doctors and experts all over the kingdom. We published papers, and we still have other papers to publish and to show the world that our experience actually, we gain a benefit from it during COVID, during MERS-CoV, and to reach to our goals and to reach to our vision, we need to have the experts in a fashionable model, in easy access to the professionals. So such papers actually will support the world to hear about our experience. I don't know if this video would work or not. Unfortunately, I was trying to upload a video, but save your times. Thank you so much for listening. I'm here to listen from you. Any questions or... حياك الله.
Thank you so much. And we have mentioned Alhamdulillah.
Alhamdulillah.
We are a ni'mah, and we have to thank our God, because we are in Saudi Arabia. And already with this presentation, we have touched the future and our services also, what will happen in the future. And you have mentioned a huge number, 20,000 experts participating in this program. This is a huge number. Within less than 1 minute, what is the final recommendation for the people who's practicing in our system to join this program and to support it?
It's a chance that if you are keen to deliver your service in other region than the region that you work on it, please do sign there. Make sure your friends, your colleagues know about visitor program. We hope that we reach 200,000 visitors signed, and they are ready at any time. If we need them, click, I can reach to this doctor.
Thank you so much.
Welcome.
Thank you, Dr. Faisal. Thank you. By closing this session, and really I am thanking Dr. Ali Asiri and Dr. Faisal Dahmashi for sharing this great information and presentation with us. Thank you so much for you also for being with us. And I would like to call Dr. Khalid Khadr to start the third session of this conference. Dr. Khalid Khadr is one of the experts in Saudi Arabia, and he's well known in his work in quality and health services. He has graduated from Britain in health service management, PhD. He's working now as advisor to the Vice Minister of Health for Planning and Development. We would like to call Dr. Khalid to save the time, and definitely if we will have more time with Dr. Khalid, he will have more discussion in these topics. Shukran. Shukran. You're welcome. Hayyak Allah.
Thank you all. Now let's start our third session with subject of sustainability and leadership going green. An experienced hospital manager with over 30 years operational and strategic experience at executive level in the Arabian Gulf, played leading roles in accreditation, business development, marketing, commissioning, renovation, and facility improvement projects, including a fully integrated paperless hospital information system. Graduated with a MBA from the University of Wales, Cardiff, MSc in Healthcare Management from the Royal College of Surgeons, Ireland, and the prestigious CBHQ via the National Association of Healthcare Equality, USA. Most recently gained certification in sustainability leadership from the University of Cambridge and Cambridge Institute of Sustainability Leadership, UK. A faculty member of the International Hospital Federation and the Geneva Sustainability Center, Switzerland, presenting mini MBA in Healthcare Management and Sustainability Master classes. A member of the American College of Healthcare Executives and past Vice President at Scientist, Advocate, and Champion of Sustainability Healthcare. Ladies and gentlemen, please join me to give a warm welcome to Dr. Christopher Lewis, Chief Executive Officer, Wise All UK.
Shukran, Dr. Khalid. Thank you for the invitation. It's a pleasure to be with you here today. Sustainability. I think these days we're all familiar with the term. It's on the news, it's on the radio, it's in the newspapers. Does sustainability affect us in healthcare? Yes or no? That's a big yes, I'm sure. Anybody here, any hospital here, they have a sustainability committee or a task force already in place? Anybody appointed, any hospital has appointed a chief sustainability officer? Okay, we'll go through this. Sustainability is a little bit like accreditation. Accreditation, as we know, covers A to Z of an organization, a healthcare facility. So too does sustainability. So there are quite a few similarities between the two, and we can touch on those as we go through. Time is of the essence, of course. We'll focus a few of our objectives. The need to decarbonize. Decarbonize what? Very good question. Climate change is a global challenge, for sure. And we'll look at some tools and some frameworks that can help us develop or enhance our sustainability strategy. Unlike accreditation, so if we follow accreditation, we're given a manual. JCI, for example, because I'm more familiar, 14 chapters, 14 chapter leaders, each chapter has a task force, and we make progress for compliance with accreditation. There is no such thing as yet. There's no standards or manual for sustainability in healthcare, but what is available is a set of pieces of the puzzle. And we can start putting these pieces together, which will help us formulate the strategy or enhance an existing strategy. So the need to decarbonize. The UN, or the United Nations Paris Climate Agreement of 2015. This was a landmark agreement. What does it mean? It means that almost 200 UN member countries around the world have signed this agreement, which means that agreement under signature is a legally binding agreement upon each of those almost 200 countries. So UK, France, Germany, Saudi Arabia, etc., 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 has a legal obligation for what? To cut CO2 emissions by 50% by 2030, and to cut CO2 emissions 100% by 2050. Do you think that's possible? You have, mashallah, I was here some years ago, I've come back recently last year, Vision 2030, and what you have achieved already is out of this world. I'm sure if any country, Saudi Arabia, can achieve this. To give you an example, yes, I believe it's achievable, 50% by 2030. If we take, for example, United Kingdom, the Industrial Revolution 250 years ago, and until recent decades, powered mostly by coal, because we had coal reserves, and we still have coal reserves, but not mined. Today, the energy mix of the United Kingdom is typically between 40 to 50% from renewable energy. For us in the UK, we're a big island, so offshore in the seas, lots of wind. We have lots of wind farms, onshore wind as well, and solar. Even in the UK, we have solar. So if one industrialized country is already at an average of 50% of its energy mix from clean energy, certainly other countries can also achieve that. Healthcare. We hear a lot in the press, the news, etc. Aviation industry making progress, sustainable aviation fuel, for example. Has anybody yet booked a ticket on an electric airplane? Anybody booked a ticket on an electric airplane? Scandinavian Airlines, SAS Airlines, you can go on the website today, you can book a ticket on its future electric airplane, an electric airplane. And this is what is so exciting about sustainability. It is new, the technology, the developments, it's being developed in front of our very eyes. It's amazing. An electric airplane, we all laugh at it, but you can now go online and book a ticket. This is a small 30-seater, range of about 300 kilometers, so it's not far. So it's a city hopper, short distances. But the technology is developing at such a rapid pace, I'm sure that becomes a 50-seater with a 500-kilometer, then a 100-seater. The world's largest airplanes, the super jumbos, they can carry, 750 passengers? Airbus and others have flown super jumbos on trial basis using used cooking oil. Cooking oil is what we use in the house, in the kitchen. Waste is not waste, and we'll touch on this. It's a resource somewhere else. So a super jumbo can fly 100% on sustainable aviation fuels. Yes, it is possible to decarbonize. We hear about shipping, aviation. Do we ever hear about healthcare industry in the papers and the need to decarbonize healthcare? Hardly. But healthcare is responsible for approximately 5.2% of global greenhouse gas emissions. 5.2. That is about the same as aviation and shipping combined. Why don't we hear about healthcare? The carbon footprint, the dirty hand of healthcare. We are the good guys. When you're sick, when you need us, you come to us. We'll help you. We are the good guys. With one hand, clean, but the other hand, it's a dirty carbon footprint, yeah, in healthcare industry. Vision 2030, mashallah. I'm so excited for your vision. It's amazing. What does the vision say about sustainability? With a commitment to clean energy and sustainability, the kingdom, can you hear me? Hello? Yep. Okay. Vision 2030, sustainability. With a commitment to clean energy and sustainability, the kingdom is leading the charge and tackling energy and climate challenges with innovative solutions such as the circular carbon economy and an increasingly diverse energy mix in which 50% of energy will come from renewable sources by 2030 as a country. So it begs the question, as healthcare leaders in your own organizations, what are you doing to achieve Vision 2030 and United Nations Climate Agreement? I'll take that off. Thank you. 2030 is what? 6 years around the corner? It's possible. It's possible with the vision and the commitment. A global challenge needs a global solution. So when you're designing your decarbonation strategy or your green strategy, green plan, call it what you want, as a foundation for the thinking in developing your green strategy, make reference to the 17 UN Sustainable Development Goals. It'll help you in your thinking and your development of the plan. An excellent paper written by the Cambridge Institute of Sustainability Leadership. It's an article titled Rewiring the Economy, 10 Tasks, 10 Years. And again, this will help in your mind to help you frame your own strategy or to enhance your strategy, your green strategy. And it emphasizes the need for government, finance, and business. We're in the healthcare business. Finance, government, and business to coordinate. There has to be a degree of coordination. Government will set the rules and regulations. And I'm sure, I'm not familiar with Saudi Arabia economy and sustainability. I'm sure there's a lot going on. That's an excellent paper to help frame the mind in developing your sustainability plan. Something else we need to be aware of is ESG, or environmental, social, and governance. We're all familiar with the financial statements, profit and loss, balance sheet, cash flow statements. So this is the performance of a business, a company, represented in financial terms. And that's the way it's always been. Yeah? Increasingly, and it's becoming law, the EU is implementing this across all EU nations. I think 27, 28 countries within the EU have to report carbon footprint and the progress that they're making or not making, as the case may be. So ESG, accounting standards, investors, we'll touch on that, investors and regulators increasingly demanding integrated reporting, requiring businesses to align financial and sustainability reporting. So you got your financial statements, part of your annual corporate report, annual report. Now, certain countries, it's already law that they have to report sustainability in there as well. So what, at company A, what is their carbon footprint? What have they done about it in the past 12 months to reduce their carbon footprint? Remember, by 50% and then 100%. Another concept that one needs, and I'll just touch on some concepts. There's a lot of reading that you need to do, a lot of research. So as part of decarbonization globally, the global business model has been the linear model. So what does this mean in relation to sustainability? Linear means a manufacturing company. It needs to get its raw materials. So it buys raw materials from mining companies. Metals, gold, oil, gas, fish from the sea. These are extractive. So we take from the planet, we take into a factory somewhere, we make stuff, an MRI machine, a projector, a car, we use it, end of life, we waste it, we throw it, usually scrapped, usually ends up in landfill. The thing is with the linear economy, there's only so much lithium, so much copper, so much gold, so much oil. An oil well will eventually run dry, of course. There's only so much resources that we can take from the planet. So the circular economy says we take, but we take less for a reason. We make, typically we waste or we throw. I'm sure through school we're all familiar with reduce, reuse, recycle. So the linear economy takes that core concept, reduce, reuse, recycle, and magnifies it to the nth degree. So rather than waste it, it goes to landfill, causes problems, environmental problems, air quality problems, etc., etc. The circular, don't waste it. That waste is somebody else's raw material. So by keeping the raw materials in use, we need to take less from the planet, Earth's natural resources. So it's a concept that every industry needs to get a grip with, the circular economy. So, decarbonize what? This is a model from the Greenhouse Gas Protocol. It is referred to as the gold standard. So, no need to reinvent the wheel. So, when you're looking at your own organization, you need to answer the question, where is the carbon emissions coming from within my organization? And this is the model that can help us, scope 1, 2, and 3. Scope 1 and 2, we manage our own healthcare facility. So we can control what we do, what we don't do with scope 1 and 2. Scope 3, so scope 1 and 2 approximately, typically, is about 30% of a company's carbon footprint. The vast majority is scope 3, your supply chain. Yeah? Your suppliers.
1 minute.
1 minute?
Yeah, please.
Some tools. The Geneva Sustainability Center has something, and just Google this. No regret measures. They have the CEL and the SAT are two digital tools to help management get to grips with sustainability. The greenhouse gas healthy hospitals, 10 sustainability tools as sustainability goals in healthcare. All this is healthcare. The operating theater in a hospital is responsible for the largest percent of carbon footprint in a hospital, operating theatres. Now, 3 of the UK Royal Colleges have gotten together recently, and hallelujah, use a checklist now. At last, there's a checklist. So if you're in the theatre, Google this. It's a 2-3 page checklist, how to green the theatre. Sign up to the Cool Food. Food is a part of it, and this will give you some ideas on how to reduce your carbon footprint through networking. Talk to others. We're all in the same boat. Same as accreditation. We're all in the same boat. Talk to friends, colleagues. Talk to your competitors. Yeah? Share ideas. Case studies. A case study that I particularly like is this one, Stony Brook University Hospital in USA. They've been winning sustainability awards for the last 10 years or more. It's on their website. See what they've done. The 10 goals. I'll give you one example. I was in, I do workshops on sustainability in healthcare, and in Abu Dhabi for 3 weeks last month. Chemicals, waste, energy, water, one hospital. This is in the Emirates. Chemicals, is anybody still using the anesthetic gas, desflurane? It's highly, highly negative environmental impact. Simply change it for alternatives. Energy, this part of the world, you're doubly blessed. Oil and gas and solar. There is no excuse. As we speak, there is a cable from Egypt, a solar park from Egypt, under the Mediterranean Sea, now being laid to Greece to help supply Europe with clean energy, and a similar plan from Morocco to the UK awaiting government approval. There is, I wanted to go through a little bit. Take the first step, a journey of 1,000 miles, just like accreditation, start. And people often ask me where to start. One word, put sustainability on your next agenda. It is as simple as that. It's not rocket science, believe me.
Thank you very much, Dr. Lewis, for this valuable. Yes, we can talk when we are standing here.
Thank you.
Just Dr. Ali Asiri talk about transforming patient safety.
Yes.
And the role of the leadership. And you're talking about also sustainability in leadership.
Yes.
Does the sustainability integrate with patient safety?
It does. It enhances, it supports. Patient safety is number one. Nothing should interfere with patient safety. We've heard that, we've seen it today on some of the presentations. So sustainability supports patient quality and safety. It should never interfere with patient safety. If it does, you leave that, or you review that aspect of sustainability that you're presently discussing. If it interferes with patient safety, you don't do it. There's alternatives. And one message that is clear, it is not business as usual. We cannot keep taking from Mother Earth the resources, and then it's run dry. What do we do as mankind, as humankind? We come to a grinding stop eventually. It is not business as usual. Thank you.
Thank you very much, Dr. Lewis, for this information, and hope to see you and join us again. Thank you very much. Okay. Now, with the role of accreditation and paving the way to high reliable health delivery. Dr. Murad Kochkia, as a manager, director of JCI Middle East Africa, Murad has been working on a wide range of consultancy projects in the region and has an extensive international experience in the healthcare operation, quality management, health information system implementation, as well as physician-hospital integration and strategic planning for healthcare. Prior to joining Joint Commissioning International, Murad served as a Group Chief Operating Officer for Burnham Hall Fertility Center, where he had overall responsibility for operations in the UAE and India. In addition, Murad worked as a hospital director for Muscat Private Hospital in Oman, where he had overall responsibility for the day-to-day operation and was accountable for the creation of the quality management structure. During this time, the hospital received the JCI accreditation. Ladies and gentlemen, please join me to give a warm welcome to Dr. Murat Kochkia, Managing Director, JCI Middle East and Africa. Mike, yours.
Thank you so much. Before I start my presentation, by the way, I would like to thank all the presenters. I think they were all great. I'm going to repeat some of them, like, just to create a stage for my presentation, but also I would like to thank Mr. Christopher. Sustainability is an incredible part of our life now, and I don't think I can think of patient safety without sustainability right now, how the world is going. Today, I'm going to talk about the high reliability. You may heard many times, and I would like to give from our Joint Commission view, also my personal view as well. Let me ask you this. Do you think that healthcare is a high reliable organization? It's considered high reliable organization? Unfortunately, not. Compared to other industries such as aviation or nuclear power plant, even zoos is considered like a high reliable organization. I just want to, this is Dr. Al-Asiri, mentioned a little bit, I'm going to add a little bit more to it, just give you a little bit understanding where we are. The Johns Hopkins made a study, and they basically indicates 250,000 people they died from the medical error. Even they say, the data available for them is complete, and that's why they're expecting maybe more than what we are seeing here. And I put here two examples to just highlight for you. Unfortunately, still today, we are making mistakes and people they are dying. Number one, first example is nurse basically use wrong drug and a patient dies. And other one is the nurse misplaced the prescription in the wrong chart, and the patient who's supposed to get the actual drug never gets it and dies as well. Accreditation, I think we are, Joint Commission has been around over 70 years. We've been accrediting around 20,000, or more than 20,000 in the United States, and internationally over 1,000 organizations. Accreditation is the daily life. I think Christopher also said, we have this, chapter leaders, we have this, the day-to-day operation, kind of especially Middle East, for us is the #1 market. A lot of organizations are leading the quality here, and we are very proud for it. It's kind of our daily work, right? This is part of us. What we gain from the accreditation, and this is actually we can all talk. I think when I talk to all the quality people, they always say the quality and the accreditation creates a structure for organization, improve the processes, help to promote a safety culture, trying to help the risk, and even the cost saving, right? Sometimes because the quality, the accreditation, enforces us to do the right thing in the first place. That allows us to create the cost saving. However, I've been in the healthcare over 30 years. Still today, we have a hand washing problem. I was talking to my daughter. She lives in the UK. She studied neuroscience, and I'm kind of rehearsing my presentation to her. And when I said 50%, her jaw dropped. She's like, come on, Dad, cannot be 50% in the hospital. Everybody's washing their hands. But that is still probably, again, a lot of quality professionals here, when we measure still what we see. We do improvements, right? We do improvements, but we don't sustain them. That's, I think, is one of the major problem. And I was reading like a couple of years ago in a major hospital, they harvest the wrong kidney from the wrong patient. And then this is happening. That's why the error happens. That's why we try to encourage the organization, like error happens, but let's try to not do harm to the patient. About over a decade ago, a couple of our experts from Joint Commission, they got together and they look at the industry that consider the high reliable, and they try to implement that expertise, knowledge, and research to the healthcare. You may have heard Dr. Chasen, he was our ex-CEO, and then also the Dr. Loeb. They published this research paper 2013. And I'm going to talk about the concept that they created, actually. They created this three pillars. Basically what they said, if the organization is going to climb the high reliable concepts, they have to have leadership commitment, and they have to create a safety culture. Safety culture means we encourage our organization team members to speak up. They can say if something's going wrong, they can speak up. And then also robust performance improvement tools. Probably a lot of you here, you have a quality department. They collect the data, they put the graphs for you. But it's very rare organization, they really get the data and convert them in information. It means, we are collecting data, but really not using it properly. Also, become a very silo, whereas in the hospital is in the quality department. Instead of everybody in the organization, they should have some kind of knowledge, improve if there's something goes wrong, and use the proper tool. And then also they suggested how we can measure where they are in the high reliability. That's why they come up this 4 different stages. It's beginning, developing, advancing, and approaching. What I'm going to do today, several years ago, we did an assessment for 860 hospitals in the United States. Interestingly, I'm going to show the data for you. This is not different than where we live. As similar things comes up, and I've been in the several assessments as an observer, and this data is very similar to what you're going to see in this region as well. The leadership domain, as you see, we are so good at having a quality strategy. Why? Because the accreditation is forced the organization to have a quality plan. That's why when we ask them, do you have any quality strategy? They say yes. But what is lacking, as you see the quality measures, right? They don't really use the data properly. And also, physician involvement, the board involvement. Somebody's asking me why the board should involve the quality. As I said, if the commitment doesn't come from the leadership, it's very hard to do, actually. Culture of the safety culture domain, the results shows trust. I was in the leadership training, and this is a major organization and very mature. They've been accredited many times. When the leadership got around the table, talk about the trust, they figured that nobody trusts each other. Departments are silo. They don't really they don't really trust. A nurse doesn't trust a doctor. Nurse doesn't trust a nurse. Or doctor doesn't trust the nurse. It comes up all the time, and there's a reason for it. That's why I'm gonna highlight that in a short. And then the performance improvement. This is I told how we use the tool. As you see, again, there's a lot of areas that develop in this area. But I would like to highlight one thing here. It's very important. We collect data, we analyze it. We don't spread it. Nobody knows what you are actually collecting and what's the outcome. You go to ICU, they have a great program. They achieve something. There's no pressure ulcer. they don't talk about it. Months, they don't talk about it. That, I think, one of the tips that I will give it to you, please, in your department, if you achieve something and continuously achieve something, and then share that information with your organization. And everybody should, and then also you should celebrate as well. Okay, what is the pathway to high reliability? This is what we believe, and the Joint Commission believes, that, accreditation is a milestone, no doubt. But it's not the end. It's not an end goal. Please keep in your mind, this, I got accreditation, I receive everything, is not the case, actually. In order to be the safe environment, you have to create a transparency. I've been reading a lot of research papers. The transparency comes up always first. If you don't have a transparency and you don't cultivate the trust, nobody will speak up. That's for sure. That's why I am encouraging all the leaders here in the room that you have to create this environment in your organization that people, they feel trusted and they trust other organizations, and also they feel to say whatever they need to say. And then the last thing is, of course, we make this. The interesting part is the doctors. I don't know if anybody like ICU nurse or ICU doctors. ICU doctors make decisions based on the data. If there's no data in their sheet, they can't. And the doctors are so used to it. But the problem is, with daily basis, we make decisions in the hospital without data. And for me, it's almost like if somebody comes and tells me, Murad, this is what we're going to do. If there's no data, I can't make a decision if I don't measure it. That's why this is something that we need to have implemented in our organization. We can be a high reliable organization. The last thing is the collective mindfulness. This is interesting. It's a very catchy word because everybody's now trying to do the yoga, this mindful everything, aware of your environment. But it's so real. If we don't do this collectively, all together, we will not going to achieve anything. We need to understand our environment. When you have a kid at home, when they're a baby, what do? You try to clear everything is not unsafe for them. Everybody's so alertful. If they move something and then they hit their heads, right? That's what we need to be feeling the same thing in our organization. Now, when I talk to the high reliable organization, what kind of organization they are, what they do, the error, they're always in their mind that something's going to go wrong. Always. It's not a pessimist way, huh? They always think that there's something going where. I'll give you an example. It's a simple example for in the ward, we have new comers, new nurses comes in. They know that they're not experienced. And if you leave them alone, you may have some problem because they need to be more mentored and then get used to the work. You have to put in your mind that something can go wrong, or anything that you do in the hospital. That's how the organizations are really working toward high reliability, or they consider that they're high reliable. They are really pay attention to that. And other thing is, I don't have any problem in the hospital. Everything's perfect. I look at the fall. I don't have any fall last 6 months. Do we need to drop that? Because the fall is the issue in the hospitals, right? We should be aware that somebody can fall. That's why you will never satisfy if you're a high level organization that if never happens, and that's going to happen again. And then also they always create this big alert that there's something is gonna something is a problem. It's small, and they give a signal that we need to fix this. And then of course the other thing is they don't simplify the observation. I'm gonna finish my my presentation, and we're on time, Very good, 20 minutes. You know, Dr. Wick and Stancliffe, there are two scholars. If you go to search about the high reliability, always they come up. And they clearly tells you here about the collective mindfulness, what does it mean for them, how they describe it. Basically, we all need to work together and understand our environment. And if something wrong, small, let's fix it now and not make it like in a bigger for us. Since I have like a little time left, I'm a very emotional guy as well. You know, when I work in the hospital, you know, I work with my passion because the quality people is like that. You know, and then my colleague, she showed me this poem. You may heard about it, but I would like to read it for you. And when you work in the hospital, and I want you to think like that. This is the guy name is Don Merrill. I don't know anybody heard about it? Don Merrill? No? Okay. This is what he says, and I'll try to do my best. Okay. This is. I chose to look the other way. This is the title of the poem. I could have saved a life that day, but I chose to look the other way. It wasn't that I didn't care. I had the time, and I was there. But I didn't want to seem a fool or argue over the safety rule. I knew he had done the job before. If I spoke up, he might get sore. The chances didn't seem that bad. I would have done the same. He knew I had. So I shook my head and walked on by. He knew the risk as well as I. He took the chance. I closed an eye, and with that act, I let him die. I could have saved a life that day, but I choose to look the other way. Now, every time I see his wife, I will know I should have saved his life. That guilt is something I must bear, but isn't it something you need to share? If you see the risk that others take, that puts their health or life at stake, the question asked or thing you say could help them live another day. If you see a risk and walk away, then hope you never have to say, I could have saved a life that day, but I choose to look the other way. Thank you.
Thank you very much, Dr. Murad. I hope that I pronounced it very well, as you would prefer.
Last name is okay.
Okay, thank you very much. It's a valuable presentation. And I have a question for you. Is it hard to implement transparency in the healthcare organizations toward the quality of healthcare?
It is very hard, no doubt, being transparent. Even ourselves, we're not transparent ourselves, you know what I mean. But that's the way how should work in order to be the high reliable organization. We need to work on it. We need to practice it. We need to implement it in our organization little by little, and then the whole organization will be able to reach that goal.
Okay, thank you very much,
You're welcome,
Dr.
sir.
Murad. Hope to see you and
Okay,
join
of
us
course.
again. Thank you very much. Okay, we're coming now to the last presentation. As a consultant adult psychiatrist with a special interest in the consultation and prenatal psychiatry, Dr. Alice trained in the UK at Bristol University and St. George's University of London. She has held medical leadership roles at South London and NHS Foundation Trust and West London NHS Trust in the UK, and is currently Associate Medical Director for Adult Services at the London Psychiatry Clinic. Her interests include quality improvement in mental health, implementing a clinical governance system that make it easy for staff and organizations to reflect and learn with the blame-free culture, and the importance of staff well-being for good quality clinical care. With her presentation on quality improvement in mental health challenges and opportunities for Saudi Arabia as the sector grows. Please join me to warm welcome to Dr. Alice Ashley, Consultant Psychiatrist, Associate Medical Director, London Psychiatry Clinics, UK. Thank you.
Thank you.
Thank you.
Thank you.
Yours.
Forgive me with my awkwardness with the microphone. This is going to be my nearest that I get to any TV talent show because I cannot sing, so I'm going to be a bit awkward with this. But I'm so honoured to be here. It's such an exciting time in Saudi Arabia, and I'm honoured to be up with such an established and amazing group of speakers today. I am a psychiatrist by background, I'm a doctor by background, although I now work in a private psychiatry clinic, which is called London Psychiatry Clinic, and you can look on our website if you scan the QR code. I have a much longer history working in the NHS, which is the UK's government sector. And I did that until December last year. So I hope to give you some pointers about what happens in terms of quality improvement in mental health in the UK. And share some best practice with you. I'm really sorry, could I have a clicker? Thank you. Or could you move on to the next slide? Could I have a clicker to move slides? Is there? Oh yeah. Brilliant. So I'm going to give you 5 key messages. So most of you are not mental health workers in this room, I should think. Most of you probably do something else. And you might be sitting there thinking, why should I be bothered about mental health? I'm a surgeon, I'm a hospital leader in an acute trust, in a trust that does medicine. But we all need to be worried about this because nothing in health happens without mental health. That's my first message. And then I've got 5 key messages for you, and this is the first one. So there's an urgent need for expansion of mental health services in KSA, and that's widely known. Unsurprisingly, KSA has a mental illness burden that's similar to other high-income countries. And PwC estimate that $3.5 billion are lost every year, and many millions of productive work days due to mental illness. If you haven't read the Saudi mental health study, which is an amazing set of work that was done based out of King Faisal Specialist Hospital in Riyadh and with the World Health Organization and Ministry of Health, you should. And it unsurprisingly showed similar rates of mental illness to other high-income countries, but terrifyingly showed that 80% of people in Saudi Arabia who have a mental illness just don't seek help at all. And you also should be interested about mental health because people with mental illness die earlier than people without. And those are startling figures. In the UK, we talk about 15 to 20 years earlier death. So that's really something we should all be bothered about. My second key message is that in order to, whatever industry you work in, so if you're out there sitting in a tech company rather than managing a hospital and you're thinking, this is not the lecture for me, this absolutely is, because every company and every industry in the whole world needs to be worried about their mental health of their workforce in order to achieve things as ambitious as Vision 2030. And Tahoon is an amazing Saudi company who, together with the National Centre for Mental Health, did a large study of employees, both in the public and private sector in KSA, and showed that 4 in 5 people who work in their study had had mental illness in the last 12 months, but only 1 in 5 had sought any help. And most of them said that their company weren't really supporting them with their mental health. And without doing that, we can't get efficiencies and savings at work. The third key message is that we are aging in KSA. So when we talk about KSA, we talk about this amazing young people, large working age population, but my colleagues in medicine are getting much better at dealing with diabetes and heart disease, and we are all going to get older. And sadly, many of us will have dementia. And so when we think about aging well, we need to be thinking about treatment and services for dementia. And startlingly, the Global Burden of Disease study, which was published in The Lancet in 2022, estimates that by 2050, there will be an increase in 900% in the number of people with Alzheimer's in KSA. The next key message is that having this integrated approach to mind and body health care will help us achieve value-based outcomes. So I'm a liaison psychiatrist. I often see people who are worried about their health, who have health anxiety, or are very worried that they may have a certain physical condition, when in fact they have an underlying anxiety, for example. And they may ask you for 10 MRI scans. And if you work particularly in the private sector like I do, you might go, okay, let's give you an MRI scan. You're going to pay for it. It might make you happy. But actually that causes no benefit and may actually be harmful for the patient. The other group of patients is anyone who has a comorbid mental illness with a physical health condition. So this little diagram is meant to show someone post-surgery in hospital, and if you have anxiety and depression post-surgery or post an MI, you're going to have higher rates of complications, have more difficulties with your rehab and recovery. So it's in all of our interest to think about doing this efficiently. The fifth key message about why you should be bothered about mental health is that KSA, in order to achieve all of this, needs to rapidly expand its mental health workforce. So there's a training and educational need for those of us who work in medicine. The Saudi Health Council and the World Bank estimate that KSA needs at least 10,000 new professionals, many new nurses and psychosocial workers, but also new psychiatrists. And that's to get to not quite the same bar as most high-income countries. So this graph on the left shows the average numbers in Europe, and that shows that in Europe, the average number of psychiatrists per 100,000 is 10.5. And in KSA, the aim is to get to 3 per 100,000 in the first instance. So clearly, we could go further. And hopefully, in the next few slides, I can tell you about some QI, so quality improvement tools, that can help not just improve what happens for our patients in mental health, but also improve the experience of people who are working in mental health and improve recruitment and retention. So why does it matter? My fellow speakers have talked about this all of today, and I'm just going to be repeating what the wise words that they've said, but we're in a complex system in healthcare of care process and pathways, and absolutely vital is how we work as a team and how those complex systems work. There are a range of approaches. I'm going to talk a bit more than my colleagues have about actual tools that you can use as a clinician or as a healthcare leader in mental health. It's a much longer talk. Many people go on week-long courses, for example, with the Institute for Healthcare Improvement, but I'm hoping to give you a bit of a snapshot in my last few minutes. So all of the approaches to QI share some key characteristics. They're all talking about trying to identify what the problems are. I love the idea of collective mindfulness that was the last speaker just talked about. So this is a job for everyone, the ward nurse, the junior doctor, up to the CEO of the hospital. And that has to be, any QI has to be embedded through everything that we do. So when I was a medical student, audit meant, and there'll be some smiling faces in the audience, I suspect, from every country, it meant dealing with a pile of paper notes, probably many piles that were on the floor up to here. And when I finally had a moment, sitting down, hiding in an office, looking through these paper notes in a very manual way, and then eventually, probably about 6 months later, presenting it to a room of people who maybe were more interested in the free lunch anyway. And then it was questionable whether anything actually changed after that meeting. And that's not how you should do QI. QI should be every day. It should be something we live through our working day. It should be stats and data that we're looking at on the ward, at the bedside, in the CEO boardroom every single day, every single week. But all of the models that we talk about identifying a quality issue, trying to understand that problem, trying to work out what the solutions are, and then trying to embed those solutions and make them stay and make them part of everyday life. And absolutely core is that collective mindfulness, that idea that everybody has a role in this in the organization. So the first approach that's become big in mental health in the UK is the lean model, which I'm sure many of you will have heard of. It comes from the Japanese car industry, and then Virginia Mason in the US was the healthcare institute who used this, and they supported a big NHS trust in the north of England called Tyne Esconweir to implement this model. And the whole idea of lean is the idea of waste being bad and value for patients being good. And anything is trying to get rid of waste and make more value. And they've achieved some amazing things in terms of their length of stay reduction. That's often a problem with mental health, so you get people who stay in hospital far longer than they need to because they don't have a home to go to, or there's social problems. There's often levels of aggression and violence that need to be tackled. And core to this idea is this idea of joy at work. So this idea that any waste is people, staff wasting time filling in forms that someone else could have done electronically means they're not doing something creative or with the patient. And flow diagrams is one of the techniques that you might see used to identify a type of waste, which is people sort of crossing over each other and duplicating what each other are doing in the patient journey. And this is a beautifully handwritten one from this BMJ article that's worth a read, but you can do it more on a computer these days. But it's basically mapping where different professionals and the patient moves in a system. And so a good example that I used to see in a forensic setting was a dentist coming to the forensic ward, because that was far more efficient that this one doctor or dentist comes to the ward rather than 10 or 15 forensic patients where a huge security presence was needed to take them to the dentist, go the other way. So the second approach is what's called the Plan, Do, Study, Act model, which many of you may have heard of. It comes from the Institute of Healthcare Improvement in the US. And the main NHS organisation that have done it in a big way in mental health is East London Foundation Trust. So I'm going to tell you about a couple of examples that they've done, which are quite notable. Again, they start off with a SMART goal and aim, a very focused thing. They try to be bold on that. And then they think, what do we need to change? Let's test that change. Let's look at the data and make sure that we know whether or not that change makes any difference. If it doesn't, we'll change again and we'll test again in that cycle. So East London, definitely a fabulous example of this in the NHS, and they're particularly fabulous because of how they've embedded it in their organisation. So it really is something that every staff member goes on training about. Everyone's encouraged, not just in a tick box way, because you have to do that for your appraisal this year, or as a junior doctor for your training, for your logbook. But every member of staff is involved and encouraged to be involved. And then it's very much something that the C-suite of the board of the trust are looking at every day in terms of data on how many patients are in beds, what the length of stay is for their mental health patients, what their number of incidents that week are or that day, and then thinking very live about what do we do about it today, and then they'll have a very board-led approach to kind of showing people what to do. So the CEO will walk into the ward and say, let's do this. And then they also have this idea of daily improvements being part of everything that we do, all the way through to a much more formal QI project that needs to be reviewed by a team. And they have a great online resource which is worth looking at called Life QI, which is a platform to register QI projects and to monitor progress. So a really great example from ELFT, which is the acronym that people use, which is a bit funny, but East London is around violence. So violence has a huge impact in mental health. It influences staff leaving, staff being injured, other patients being injured, patients being distressed because it reawakens trauma for them. People stay longer as inpatients, all sorts of things. So this is one other tool that we use in the PDSA model. It's called a driver diagram, and it starts with an aim, which has to be SMART. So this is their aim was to reduce violence at this particular hospital by 30% by March 2016. Then you start with the primary drivers, which are the big ticket things that you need to work on to achieve your aim. And then you get the secondary drivers, which are all the little things that make up that primary driver. And then out of that, you get change ideas, so things you can try to see if they work, to change things. And then to make it doable, what they've done is they've said, we won't try and do all of these things at once. We'll try these 4 change ideas, and then we might come back to the other things, but we're going to try these 4 things first. So these 4 things they tried were a particular predictive violence checklist from Norway, safety crosses, which you may have seen on a building site, but we also use them in mental health. So a green day is when there's been no violence on the ward. A red is obviously when there has been. they used what was called safety huddles. So instead, again, when I was a junior doctor in psychiatry in the UK, a ward round was often a big meeting in a meeting room with coffee. It was slow, it took all day, and it probably happened once a week. And if you missed that one, then you didn't get discharged this week, and you just stayed. So this is a completely different thing. Quick, 15 minutes, 2 to 3 times a day, talking about safety, talking about patients' wellness, their difficulties that day, their medications, their side effects, their happiness with things. And then this is what's called a run chart. It's another a statistical way of looking at data. So this kind of chart would be looked at by the board of East London every week in their sort of flow meetings. So their meetings about how many patients are in the wards and things. And it's a way of measuring natural variation. So you always expect things like incidents of violence to go up and down. That's always going to happen. But a run chart gives you a statistical way of making sure that you know when you're actually supposed to be moving when you actually have made a difference as opposed to a difference to chance. And so there's various, and again, you can go on a whole training course about this, so I don't really have time to talk about it at length. But a run chart based on various kind of rules about how many points you have to have above the line, below the line to find a trend. So the one last example that I'd like to talk about in my last 30 seconds is around staff well-being, and the other really good example is the Institute of Health Improvement's Joy at Work framework. And this is basically about involving staff in what makes them happy at work. And you ask them, we know that healthcare workers struggle with their health, and that's really important for recruitment and retention. And so there's 2 steps. You encourage staff to talk about what helps, and you encourage them to talk about what gets in their way. And this is a rather wordy slide, but you can take a photo of it or ask me to send it to you. But it's loads of ideas that included anything from yoga to I need to be involved in the ward round, I feel left out. And the one more example that I wanted to give you is King's Health Partners. So King's Health Partners is a rather unique group of trusts in the UK, which includes Guy's and St Thomas's, King's, and South London and the Maudsley, as well as King's University. And so it includes physical health and mental health partners. And they have set up their Quality Improvement Network, which essentially is an accreditation system for we do good things in mental health and physical health. And it's a really worth looking at as a model. And that's it.
Thank you very much, Dr. Alice, for this valuable presentation.
Thank you.
Thank you. Just I would like to ask you a question. At the beginning, you said, I have 5 key messages.
Yes.
Is that right? Huh?
Yes.
So now I would like to ask you, what is the one key message that you could provide for healthcare leadership and audiences
it's
in this?
a good question. I think actually I'm going to slightly contradict myself by saying it's none of those 5, which is really stupid probably on my account. But I'd say my one key message actually is about the staff involvement, and I'm going to steal the idea of the previous speaker about collective mindfulness and everybody being empowered to be involved in how they enjoy their work day and what happens for their patients. I always think we historically ignored the views of more junior people and people who are new to the team when in fact they know what's going on. They know what's going on better than those of us who are on the board and in the management roles because they see it every day. And they move around a lot more around different hospitals, and they turn up and they say, why do they do it like that here? But because they're being very good, obedient, good workers, they go, okay, I need to change how I'm doing it, and I'll do it the new way, how that consultant likes things done, instead of being given the space to say, actually, could we do it this other way? So we need to listen to that.
Okay, thank you very much, Alice, and hope to join and see you again.
Thank you.
Thank you very much. Thank you. Okay, ladies and gentlemen, let's now move to the last session. Session number 4, initiatives toward the quality of care. And I would like to introduce my colleague, Dr. Abdul Latif Al-Okaifi, the advisor for Assistant Deputy Minister for Hospital Services, General Supervisor for WASN program. He started his task for Ministry of Health as a Director of Strategic Planning for Quality and Patient Safety. He has different experiences in both governmental and private healthcare institution and hospital as an executive director. Please join me to welcome Dr. Abdul Latif Al-Okaifi. Mike, yours. Thank you.
Thank you so
Good luck.
much. Thank you, Dr. Khalid, and would like first of all to thank all of the people coming to this session, and I hope you will enjoy with our session. For sure, the last session was talking about the accreditation, and now we will talk about initiatives towards the quality of care. I'm having 3 speakers, and every speaker will give you some insights. We'll start with our first speaker. Our first speaker is Dr. Maram Al-Utaibi. Dr. Maram is currently the President and the CEO of Health Support Services Center and the leader of RID Biotechnology File at Saudi Ministry of Health, an active member of the Saudi National Biotechnology and Saudi German Program 2.0 Committee. She held many of the several positions in MOH and also in other institutions like in King Saud University Hospital and also in King Saud University Medical City. She was the associated professor of medicine and consultant of molecular genetics, director of genetic services, head of cytogenetics and also molecular genetics lab, and the director of German project. As far as I know, Dr. Maram, she is, mashallah, engine of quality, of moving, and I know her closely how she is doing things from nothing. Today you will enjoy with her talk about transformation, health delivery, leveraging HSSC COVID-19 experience to improve quality of care. Please join me to welcome Dr. Maram. Stage is yours.
I think oh, great. Thank you. Good evening, everyone, and thank you, Dr. Abdul Latif, for the nice welcoming. It is really my pleasure to be with you in this afternoon. And I'm lucky to be speaking to a crowd like you guys. And I'm honored to take this opportunity to share with you our COVID experience and how we use COVID experience to build what we call it the HSSC, the Health Support Services. An area that covers the laboratory services, the blood banks, as well as the forensic medical services. I would like to start by quoting His Majesty, King Salman. The quote you can see here up on the screen illustrates the government commitment to the safety of every person living in the land of the kingdom. It wasn't easy to deliver on COVID without a strong commitment from the government, as well as strong governance. We wouldn't be able to achieve where we achieved in COVID. Today, I'll walk you through a brief history of who we are and the phases we took in order to come up with what we call today the health support services. We started in a war room, 4x6, starting with the unknown, dealing with COVID that hit the world in 2020. It wasn't an easy journey. As His Excellency the Minister mentioned, is dealing with the unknown. There's no manual and there's no book we can give to any healthcare providers to deal with the unknown. The success of the team in COVID enabled us to create the health support services, to oversee the lab services, the blood banks, forensic, and recently the biotech. We couldn't do it without a strong operation system behind us, the supply chain, the digital, as well as equipment. And allow me to walk you through the steps we took in the past 3 years to solidify our operation to ensure the safety and the quality of healthcare delivery of the services under the health support services. It is a journey from red to green. The red illustrates the situation in 2020 in the global countries. All countries were hit with the pandemic. No one knows what to do. We started to gather our thinking and understanding the gaps. And how can we strategize to solve the pandemic? The gaps is illustrated here, the silos. So we were working in silos across the kingdom. There's no standards of communication, repetition, lack of access to data, as well as lack of visibility on what's going on in the ground. Did the sample get picked up? Where did it get picked up? Did it deliver to the lab? Did the lab get the test? Did the citizen get it? The strategies are highlighted in the second column. Definitely, we need to standardize our operation. Optimization was key. Digital enabling was our guiding and our driving principle. I guess most of us, and according to data, 40 million people have used the app Sahati to book an appointment, to go to a drive-through, as well as to get their swab test and the test results in the app. And I'll capitalize on that experience. And how did this put the kingdom at global ranking and references? This lab was one lab when it started the COVID. We were able to have a full-fledged laboratory consist of 27 laboratories across the kingdom. Key KPIs were there. How many of you guys used it? The COVID driving. According to the surveys, 94% of you were satisfied with our services. We were the global reference. We were second to Korea when it comes to turnaround time. Saudi Arabia was cited more than 1,000 citations, reflecting the TAT, reflecting our quality of delivery, as well as putting the kingdom at #1 when it comes to positivity rate. As I told you, 40 million tests was conducted in all of these sites. Definitely, quality was at the central and the heart of this operation, ensuring that this laboratory is functioning and operating per local as well as international standards. A lot of publications came out from the work that was done in Saudi Arabia. I was personally proud of seeing the kingdom getting reference across many articles illustrating the efforts that the kingdom has done in order to successfully deliver the COVID testing at a national scale. We learned it the hard way. We learned it through COVID. COVID experiences gave us so much insight into how can we learn from our operation and operation excellence to deliver on the Ministry of Health strategic objectives: access to care, quality of care, as well prevention of diseases. And then allow me in the next few slides to share with you some key initiatives that we undertaken to ensure the progress and the momentum when it comes to healthcare delivery. This slide illustrates the backbone. Without these key operational excellence, we wouldn't be able to deliver on COVID as well as the current and the future. The future looks bright. It is amazing, and I'm very honored to work with the Ministry of Health as well with an amazing team to deliver these projects. We understand the challenges that's happening in the kingdom. A lot of send-out tests is happening. We're working very hard to localize a kingdom reference lab to ensure that all tests to be done locally. تأكد Gen 2. So the app صحتي to go to تأكد sites, to get your swab, to get your results on your phone, has shown 94% satisfaction rate, as well as it is already becoming a brand in the society. You like it. You like the experience. So we want to capitalize on it. And we will very soon announce تأكد Gen 2. The same concept. How can we enable you to be in charge of your health, to give you the access to healthcare deliveries, to virtual hospital if needed, as well as to various laboratory testing, vaccine, blood donations, and others. Send-out office was as well established to cover for the send-out numbers and to have a clear visibility on what gets sent out from the kingdom and where is the necessary intervention needs to be. عينتي is one of the ambitious projects for the Ministry of Health. I'm sure a lot of you go to your doctor regularly and you do your test. How many of you have their test in their phone? Is it in an app? If I look at the number, 30% of you here have it. Very soon, Q4 will announce عينتي for the Ministry of Health. So all laboratory testing will be in صحتي. This will definitely enhance a lot of pillars. One of them is quality, but efficiency is key as well, and to ensure that you are empowered on your health, you're empowered on your results. Biosafety as well is an ambitious project that we would like to know how is our laboratory performing, how is our community responding to various outbreaks. Point of care testing is critical. There's a big advancement in this field. More new technologies, more new point of care testing is developed, and we have actually taken steps to establish an office that's dedicated to look at the point of care testing. Biotech is a major topic, and excuse me, allow me to move it to a different talk to walk you through the biotech and how we're moving the kingdom to be a global hub for biotechnology. Here is a summary of the Kingdom Reference Lab projects and their strategic objectives. The main objective is to localize testing and to ensure that tests can be done locally, reduce the turnaround time that our citizen and our community wait to get their test. تأكد Gen 2, I elaborated a little bit when I was introducing it, but here are the first initial list that we will cover in تأكد Gen 2. And you can see these services were handpicked based on criteria to really help the community to have access to these services. عينتي is a digital platform that will enable all of individuals in Saudi Arabia to have access to their laboratory testing, even if it was a send-out as well. Send-out office was established to ensure a strong governance and control of what actually gets sent out and what is exactly the purpose of having it done outside the kingdom. There was a statistic was done by this office showing that 1,000+ tests is being sent out, the quality, the price as well, the costing the kingdom for all of these tests. We were sure that this is a gap that needs to be addressed and to be solved in order to provide the healthcare quality that needed. A lot of us wait for 6 weeks, months, for a lab to be sent out and to get back the results. Public health is also important for us to ensure the safety of our residents. We wanted to make sure that we're capturing any outbreaks, la samah Allah, in anywhere in the kingdom. An operation center was established to detect all laboratory tests related to public health. As I mentioned as well, point-of-care testing is becoming critical in our current years. There's a huge focus on it after COVID operation, and more of us got used to doing their own test. You take it, you do the rapid testing, you get the results in 15 minutes. It's convenience, everybody likes it. More and more companies are investing in point-of-care testing. However, it needs a control, it needs governance, ensuring efficiency as well as quality. Red Biotechnology is the health biotech. Allow me to skip this slide, as biotechnology, to give it its deserved time, it needs a whole session. And due to as well the time of this conference, I'll skip it. But if you need any questions, feel free to approach me, and I can elaborate further into the Red Biotechnology. All of this amazing work wouldn't be possible with an amazing team. There was an army behind this operation. Without a clear vision, a strong commitment, we wouldn't be able to deliver these healthcare services at its highest quality. I have some of them here, and I can't thank you enough for all of your effort and allowing me to share it with the audience that we have today. My pleasure speaking to you all, and thank you. And if you have any questions, let me know. I'll give it to you, Dr. Abdul Latif.
Thank you so much, Dr. Maram. Your presentation is full of positivity, except the first slides, which show us the COVID time to go where and nowhere. And thank you so much. Dr. Khalid was asking me to do one question.
Only one question?
Only one question. And I will be the one. But my question will be sent to the audience. So anyone would like to ask, the first who will raise the hand will select. If you have any question to Dr. Maram. If you don't have, I will ask her my question. Please go ahead. Can we give a mic in here? Can you raise your hand so they can see you? One question, huh? Small question. Not a big one.
السلام عليكم دكتورة أهداب اسكندر أم القرى University College of Nursing.
ما أسمعك دكتورة لو تعيدين مرة ثانية عذرا.
اسمي دكتورة أهداب اسكندر. My name is أهداب اسكندر. I'm a assistant nursing professor in أم القرى University. My question is about تأكد. Would it include mammogram screening? Because I know we don't have a national program, so it would be really helpful to include mammogram results as the recommendation for women to have it once every 2 weeks or depending.
ايش التست دكتورة؟
البرنامج الابلكيشن اللي اعلنتي عنه اسمه تأكد.
صحيح في برنامج.
Would it include mammogram?
Would it include what?
Mammogram.
Oh, amazing.
Yeah.
Excellent.
Yeah. Thank you.
Thank you, دكتورة. I would tell you, if there is a proven case that is needed, we'll definitely have it. These sites are meant to really as well create an awareness. I know we're the last day of October of the breast cancer awareness, and thank you for raising this point. Mammogram is important for any female with us in the room, for the men, for your moms, your wives, your sisters. Yani, thank you for allowing me to conclude with this. I highly encourage you to really push all of the female in your household to go get a mammogram. It is critical, it's important, it's actually saved lives. I couldn't agree more with you, Doctora. It is critical. Inshallah, you will see it in تأكد Gen 2 بإذن الله. شكرا لكم جميعا.
Thank you.
شكرا دكتور عبد اللطيف.
Thank you, Dr. Maram. Thank you so much for your participation. And we were very alerted about COVID, but it was a positive presentation. Now we will move to the second speaker. Our second speaker is Dr. Abdurrahman Al-Malki. He is the Deputy General Director for General Directorate of Patient Experience. He is with extensive experience in patient care and care customer experience also. Dr. Abdurrahman was also certified in patient experience leadership from the Bayer Institute, and also he is a qualified trainer in patient experience. He was participated in establishing Saudi standards for human-centered care. طبعا هذه هي المعايير السعودية للرعاية المرتكزة على الإنسان. كان هو واحد من الأشخاص اللي عملوا هذه المعايير اللي اليوم بيتكلم لنا الدكتور عبد الرحمن about the patient experience initiatives in MOH, and we'll try to link it with equality. Please join me to welcome Dr. Abdul Rahman. Also, we need to squeeze the time of Dr. Abdul Rahman, or if his time will not be squeezed, we will squeeze him. So please join me to welcome Dr. Abdul Rahman. حياك الله دكتور.
Thank you, Dr. Abdul Latif. Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon, everyone. It's my pleasure to be here today talking about the patient experience initiatives to enhance the quality of care and patient safety and to improve our health services. First and foremost, I would like to thank Dr. Khalid Khadr for inviting me at this session and introducing the Patient Experience Center works, projects, improvement projects that we are targeting in Ministry of Health to improve our health services. Also, I would like to thank you all for attending this session at this time today. This is the agenda that I'm going to cover in my presentation. I will talk about the patient experience and why is it important, and I will elaborate more with the statistics and numbers. Then I'm going to talk about the Patient Experience Center at the Ministry of Health and the initiatives that we are implementing and monitoring at the center. Let's start with the definition of patient experience. Some people think the patient experience is about satisfaction, it's about entertainment, it's about making patients happy, which is not only about these three things or about fancy building, fancy waiting area. It's more about interaction with patients. It's more about the culture of the organization, the value, the vision, the strategy of that organization. It's more about the patient perception, what they think they will receive from this organization, and their value of the service that they have received. It's also about the pre, during, and post services, the continuum of care. So the Bayer Institute has defined the patient experience as the sum of all interactions that shaped by an organization culture which influence the patient perceptions across the continuum of care. So we have many aspects that affecting the patient experience. If we consider these effects by improvement, by projects, by initiatives, we will have the optimal and ultimate patient experience. We have the communication. We have the shared decision making. We should engage patients. And we have the access to care. Is it face-to-face clinic or is it online? Do patients have the facility? Do the patients have the right to get the virtual clinic, or they need to go to the hospital? All these aspects, if we consider it, we will have a positive patient experience. So why patient experience is matter? because it will enhance the overall quality of care. It will improve the clinical outcomes, and I will elaborate more about this in the next slide. It will increase the patient engagement. The patient experience is about empowerment, engagement, involving patient in decision making. So it will also higher the satisfaction score at the facility. At this slide, I'm going to elaborate more about the importance of patient experience based on studies and research. Patients who report high satisfaction are 26% less likely to be readmitted to the hospital within 30 days of discharge. Also, the patient experience and effective communication will reduce the risk of medical errors by 19%. Adding to that, the improving patient engagement, which is a part of patient experience, can lead to a 30% decrease in prescription errors. A patient-centered approach, which is the ultimate approach of patient experience, is associated with a 15% increase in adherence to medical advices. If we look at these 4 results, we will find it that they interconnected to each other in some way. It's about communication, it's about engagement, it's about empowering patients. Adding to that, 78% of healthcare employees feel more motivated when patient experience is prioritized. So also it will reduce the turnover rate by 25% among healthcare providers. Also, the positive experience contributes to increased patient retention and loyalty. So those patients with chronic disease, we should keep them remain at our services. So the patient experience is the good way to keep them at our services. And this is also good for private hospital to increase their margin of profits. At the Ministry of Health, we have defined the patient experience as a comprehensive personalized care to patients and families delivered by proud, engaged healthcare heroes, as we believe in our healthcare providers as a patient experience. So we have a purpose at the Patient Experience Center to create a national excellence in patient care through effective partnership with patients, families, and caregivers. We believe in partnership, we believe in engagement, empowerment of both the healthcare providers and the patient, and they should be participated in the decision making. We have a promise at the Patient Experience Center, and we are working on that through some standards that we initiated lately about the human-centered care for all. So all hospitals should follow the guidelines of Saudi standard for human-centered care. At the center, we are building our strategy and vision toward the optimal of services delivered to the patient. So we have a national standard of person-centered care as a cornerstone of the Patient Experience Center. So we have an obligation and commitment to protect the patient rights through empowering patients by providing the Bill of Rights documents and by providing complaint management guidelines to assure the availability of effective natural feedback channels for our patients. Also, we are measuring the health services that provided in Ministry of Health, and we are training and educating our healthcare providers to be a patient experience. I would like to say that the patient experience is not only in the office, in the patient experience office, it's all responsibility who working in healthcare system. Here are the main initiatives that we are implementing and monitoring at the Ministry of Health. We have the Bill of Rights, complaint management guidelines. We have the Saudi standards of human-centered care. We have the patient experience measurement program. We have done some campaigns to promote the communication among our healthcare providers. The Bill of Rights, we have a document that clarifies the rights for patients and their responsibility toward the healthcare facilities to ensure that the patient well aware of all information related to their health condition in an adequate manner and in understandable language. So the complaint management guidelines, as we believe that the complaint is an excellent source of information for improvement and transformation of our healthcare system. So we initiated this guideline to become a source on directing beneficiaries on how, whom, and when complain. So this is the framework that we are following in our, to implement these guidelines. So each organization and leaders should be committed and involved in the process of complaint. They should have a clear policies about the process of complaint, and they also should empower the complaint officer to be participated in the decision making, and they should have a high standard of archiving system to avoid reoccurrence of the complaint. And all these guidelines should have policies and cover all stages, and employees should be aware, and the patient should be identified about this process. The patient experience measurement program started on 2018. We started at the first quarter on 2018 with 5 services. We have about 5,000 completed survey. The last quarter in 2023, we have measuring about 36 services. We collected about 500,000 survey from our patient who receive our services. So we are prioritizing our services, our gap, through the patient point of view, and we are targeting the gap with the improvement projects. So we are also comparing our results with the national and international healthcare providers. So the program improving the services provided to beneficiaries through their point of view, and introducing the concept of patient experience and promoting a culture of continuous and sustainable improvement. As you can see here at this chart, this is from the comment dashboard. We are using AI tool to analyze the comments. So we do have, as you can see here, most of the patient talking about courtesy and respect in both negative and positive way, which means it is the important things to our patient to treat them with dignity, with respect. So they are talking also in the right chart about the courtesy, about the waiting time, about the availability of appointment. We are targeting all these issues with our initiatives and improvement projects. So the key elements of successful patient experience improvement projects is to have a clear goal and objectives, and to involve the stakeholders like patients, healthcare providers, leaders, and to build your improvement project based on data, and ongoing evaluation will show you if that project achieved what's intended to achieve. Here are another initiatives that we are running in Patient Experience Center. Priority card to facilitate procedure and services provided to a special group of patients at healthcare, those over 60 years old and people with disability. And we have the PFAC committee, the formal group of patients, to improve the patient experience. We have the virtual visit, which is different from the virtual clinic. We are enabling patients to communicate with their family in a hospital. The leadership round, we believe that if leaders perform round, they will collect actionable information from the patient and their staff. The Saudi standard of human-centered care, it's about care plan delivered and designed in active partnership with our patients, which will ensure that their needs and perception are met. Here are some campaigns that we have done in the Ministry of Health to encourage and promote the communication among our healthcare providers, like a STAN campaign. We have a Touch of Empathy campaign. So also we believe in motivation and incentives, as our organization would work hard to improve their services, and this will encourage the organization and healthcare providers to do the best and excellent services, which will leave a positive impact on our patients. الصحة platform, which is not one of our initiatives, but it's one of the supportive program at Ministry of Health, which decrease the waiting time, which provide availability of appointment, the issue I have talked about, from the AI analysis for the comment that we generated from our patient. Here are the references that I have used in my presentation. I would love if this presentation is insightful and valuable to you all, and thank you.
شكرا جزيلا. أي تجي الحين جت. شكرا جزيلا عبد الرحمن، الله يعطيك العافية. Thank you for يعني the time having the speakers with me. If you need to see a good trainer and people who will put a goal to achieve, يضعون أمامهم أهداف يحققونها. شوفوا هذا المثال. وماي next speaker. I have one question to عبد الرحمن. ما شاء الله many initiatives that have been saying in there. Within 30 seconds, can you summarize the key information that will take it home with us?
I would recommend that if we leave this session with one sentence, that we should treat our patient with empathy. That would do more than enough. It will reach the optimal patient experience approach.
Thank you. Thank you so much. Thank you, Dr. Rahman. Our next speaker is Dr. Ibrahim Belharith. He is the Chief Quality and Excellence Officer at الصحة Virtual Hospital and Innovation Enablement Center. Dr. Abdurrahman, mashallah, Dr. Ibrahim is having a professional with 20 years experience in a clinical, and also he is a good trainer, teaching the people on planning, organizing, implementation, also organizational projects. He is conducting value-based workshops, seminar to the staff to know about how we achieve value-based. He is a quality consultant for accreditation, Sebahi, GCI, Canadian. I know him closely. I have worked with him in Saha Hospital. MashaAllah, he was one of the engine moving the hospital to achieve the accreditation. Please join me to welcome Dr. Ibrahim. He will talk today about our journey in Saha Virtual Hospital to quality excellence. Dr. Ibrahim.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. I know it is the last presentation on this day, but for Saha Virtual Hospital, I think it is the beginning, because Saha Virtual Hospital is the new future of healthcare system. As Dr. Ali Asiri in his last presentation mentioned, that we want to be a new future for healthcare system. So first of all, I want to thank Dr. Khalid and Dr. Abdul Latif for this chance for me to speak today about our journey in Saha Virtual Hospital. So Saha Virtual Hospital reach or achieve a significant milestone during the initiatives of this hospital since 2021. Saha Virtual Hospital is the largest of its kind globally, and he is the first in the Middle East. Saha Virtual Hospital is the first virtual hospital in the world obtaining the Canadian Diamond category accreditation, which is the high level of accreditation in Canadian Association. As you know, we often have challenges in healthcare system, and the society faces significant challenges in healthcare which affect the quality and the safety of our services, like the increase of diseases rate like COVID-19 and the chronic diseases. And also, one of the significant challenges is the geographical barriers that they get the proper care. So a lot of cities in Kingdom of Saudi Arabia or outside of Kingdom, they don't have the expert consultation in some specialties that they have to travel and to have to go out of their regions to get this consultation. A human resource gap as Dr. Ali Asiri also mentioned, that there is shortage of staff, especially with nurses and bedside nurses, that they have to monitor our patients. The treatment cost increase and the treatment delay. And this is, I think, what the global health that they need to invest on this. Health justice and also health security. So to enhance the capability of this health sector to face these challenges, I think so it become, and this is one of the pillars of the Vision 2030 for the MOH, that they need to do the digitalization and innovation and research to improve the service of healthcare system. Employ modern technology and AI, and also take advantage of data. So what is Saha Virtual Hospital? Saha Virtual Hospital, Saha, it is a standing of health and well-being by Arabic, and it is a specialized facility at it use the latest innovation technology to provide specialized services to support health facilities in the kingdom. And it is in the digital city on the MOH building. So they have a hospital for that. Our vision and mission and also goals, you can see it in the screen. We focus on 6 goals that to achieve our objectives and strategic goals, which is improve access to care for patients, especially, as I said, the geographical barriers from some cities that they have to leave their home and also leave their regions. So the improved access of care, it is one of the goals for Saha Virtual Hospital. Also expand the clinical excellence. Our expert, we will mention it in the, I think, next slides. Our experts, they are exchanging knowledge between our practitioners and the connected hospital practitioners. Enhance experience and also transfer of knowledge, drive better outcomes, and finally reduce the cost of care. Based on the strategic orientation of the hospital, we have identified 4 strategic objectives, which is improve the virtual health and also resource development and sustainability, and promoting innovation and knowledge transfer, and finally achieve institutional excellence. This is the main 5 types of services that Saha Virtual Hospital now deliver to our patient. Of course, it was not like it was not 5 main services, but now we have more than 5 type of services that Saha Virtual Hospital do it for our patients and also for a connected hospital. The first type of service, or the first stream, which is the acute critical care virtual consultation. Our experts, they are using advanced video conference system to connect with the practitioners in in the Ministry of Health Hospital from different regions. And we will the next slide, we will see how many hospitals we are connected with. So in this stream, acute and critical care virtual consultation, is divided to adult critical care and neonatal critical care, and also pediatric critical care, and also telestroke. Second stream, which is virtual specialized clinic, and providing specialized medical services in many subspecialties that a lot of cities, they don't have these specialties in their regions. So for patients who have been referred to Saha Virtual Hospital through the virtual referral program and virtual shared clinic program. The third streaming, which is the virtual multidisciplinary committees, and here the consultant with the healthcare professionals, they are also the experts from several specialties meet to study medical cases, referral, from health facilities with access to related details and data like patient history, test result, and X-ray to provide accurate and immediate specialized medical recommendation. And we have now 4 services for virtual multidisciplinary committees, which is the cardiac and the diabetes and psychiatric and also oncology. The 4th stream, which is supportive medical services, the virtual radiology services, our team, they are including high specialized consultant provide service like reading reports, diagnosis result, and issue reports to patient in associated hospital that do not have specialized radiology consultation available. The 5th stream is the home care services. And this medical team, under the supervision of a specialized consultant, provide integrated medical services to patients in their homes for cases that they need follow-up and do not require hospitalization to decrease the hospital bed occupancy for the most needed patients. We are proud in Saha Virtual Hospital that we reach more than 100,000 beneficiaries, and also we have now 19 category specialists, and subspecialty we reach 52, and we connect with 170 hospital for all the regions in Saudi Arabia. This all done by around 190 heroes who are working in Saha Virtual Hospital daily and in every time to give care for our patients. So we start our journey in quality by doing a critical assessment from the Commission's checklist. That's what the MOH launched to just prepare the hospital for their operations, to make sure that this hospital, they have the readiness to be safe for our patients. And we passed this Commission's checklist by 90% in 2021. Then we designed this approach for virtual services design and operational competent for every service that we have. So any service in our hospital, they have to go with this 6 steps, which is service strategy. So we have to know what is the business case for any service that we launch it, and then the strategic objectives and also the KPIs for each one. The next step, which is the clinical governance structure for any services that we have our teams that have to build all clinical governance elements, which is contain the organizational structure, role and responsibility, and also the competency and job description for every service, and the escalation level and reporting governance. The 3rd step, which is the service and stakeholder identification, and we have to identify our stakeholders for every service that we launch it in Saha Virtual Hospital. Then the operating model, the 5th step, which is the operation requirement development, and finally it's the performance measurement. Saha Virtual Hospital contribute for achieving the healthcare quality domains and help the connected hospital to achieve this. So we keep our patients safe from the physical hospital by providing consultation for them without going to the hospital, and they can affected by any infection. Also the effectiveness, Saha Virtual Hospital, they have launched the updated guidelines and protocols, and we always discuss with our partner hospital consultant or healthcare provider. In each session, we have to transfer knowledge to them in every time. For patient-centered, we are focusing on patient-centered and person, not in technology. some of the people think that we are as a virtual hospital. They are thinking that we are dealing with technology, but no. Unfortunately, we are dealing with our patients as a person. So we give the patients all the time, discuss with them in any case what he need to do. Effectiveness, and this done by doing the avoiding waste, including the waste of equipment, supplies, idea, and energy. And timely, and this Saha Virtual Hospital help the connected hospital by decreasing the long time of waiting, especially for consultation or consultant, or some specialties that some regions they don't have, so they have to wait maybe months to get this consultation. We are now decreasing the long time by providing this consultation through our expert to the connected hospital. So to understand the quality excellence, Saha Virtual Hospital, as I said, even if it is a hospital, but we are trying to improve the quality and patient care through our connection to this connected or to the partner hospital by implementing and discussing cases by cases for every patient, utilizing every step of quality by discussing the healthcare outcomes and see what is the care plan for our patients, how our expert can modify this care plan to get the patient safely and also better care. Continuity of care, and this is what we are done even if the patient discharged from the connected hospital or partner hospital. We are trying, our case managers and nurses, they are doing the round to follow up for these patients daily and monthly to see if they have any questions or suggestions or any problem that they face, so we can help them to get the correct care. Patient satisfaction, if in Saha Virtual Hospital, as I said, we are focusing for our patients, and we're trying all the time to see what is the opinion of our patients. We have weekly meeting from our CEO, Engineer Muna Sibai. She are weekly connected with at least 20 patients weekly to see if they are satisfied, if they have any issue that they face with our services. Accessibility and convenience, and this is what we are saying. We are provide the access to care, to our care, and to also a lot of cares to our patients without any excuse. If the patients need the appointment will be done within 24 hours, we can provide it for our patients, and also by using the convenience. So if they need it by morning or any time they want during the 24 hours. So lastly, as Dr. Ali also mentioned, and Dr. Nahar Al-Azzam said, that Saha Virtual Hospital will ensure sensitivity that contribute to enhance the efficacy of health sector and making the Kingdom of Saudi Arabia a global reference for virtual health care, and we are. Thank you very much.
يعطيك العافية إبراهيم، شكرا جزيلا. احنا يمكن صحة مستشفى صحة الافتراضي من المشاريع اللي نفخر بها في البلد، فشكرا. عندنا one question if you allow us دكتور خالد. 2 questions 3 طماعين، بس ما نثقل عليكم، معلش استحملونا شوي، بناخذ سؤالين. يلا، في واحدة وراك على طول تبغى تسأل، رافعة يدها قبل ما يخلص إبراهيم، تستاهل.
We will take 2 questions, and if there is any question you can just use Twitter, you will see us there.
خلاص. So the one behind
Yes.
دكتور خالد. Yes, here. Can you raise your hand? إيه. بالله سؤال صعب.
Okay.
Please.
السلام عليكم ورحمة الله وبركاته. اسمي بشائر، متطوع صحي من جدة. إذا تتكرم حابة أسأل بالعربي. أعوذ بالله من الشيطان الرجيم. لاحظت في أحد السلايدات سايكاتريك راديولوجي، ممكن شيء ملخص عنه إذا تكرمت عن الخدمة في المستشفى الصحي الافتراضي تبعكم؟ ويعطيك العافية.
سايكاتريك؟
كأني لاحظت كده.
طبعا أكيد عندنا مستشفى الصحة الافتراضي في 5 مسارات رئيسية. واحد من المسارات subspecialties is psychiatric, and the psychiatric for subspecialties. For psychiatric, we have the addictions. We have a lot of clinic. I think around 15 clinic under the psychiatric. So I think it is run from Dr. Hassan Shihri. He's the consultant, psychiatric consultant, one of the leaders for psychiatric in Saudi Arabia. دكتور حسن طبعا هو واحد من القادة اللي معروفين في مستشفى الصحة الافتراضي وعلى مستوى المملكة في موضوع الصحة النفسية. طبعا احنا نقدم مثل ما ذكرت لك، احنا نقدم الطب الجنائي، نقدم الصحة النفسية العقلية، نقدم الإدمان، أيضا للسجون، فعدة تخصصات صراحة في مستشفى الصحة الافتراضي. ممكن تلاقينها موجودة في الدليل الخاص، وهذا موزع في مستشفى الصحة الافتراضي في موقع الوزارة.
يعني في خدمة راديولوجي سايكاتريك؟
رايدولوجي سايكاتريك ما في.
ما في، اوكي
لا.
خلاص.
رايدولوجي سايكاتريك ما في.
اوكي يعطيك العافية، شكرا.
حياك.
Another question? Anyone have another question? Can I see hands?
ما في hands. خلاص.
Okay, I'm having question to you, Ibrahim. Next, what we are thinking about. Now, we can see the 5 main services, and this is the scope of service اللي هي في صحة. So what's next? What we can see in 2024, 2025? What are the services that we are promising to have in future?
Thank you, Dr. Abdul Latif. As I mentioned in my presentation, today it is 5 stream or 5 services, but tomorrow it will be more than 10. Because as our minister visits us today, and he see our strategic that we will open a lot of streams and services by the year of 2040. So I think in the end of this year, 2023, I think we will open more than 5, so it will be 10 by the end of this year.
ما شاء الله تبارك الله.
Yes.
Thank you so much. Thank you, Ibrahim.
You're welcome. You're welcome.
الله يعطيك العافية. شكرا جزيلا. الله يعافيك. Now is the time to close this session. بس I don't want to close. ما شاء الله جالسين هم لحد الآن. فإحنا we can give them more presentation if you would like. Okay. The floor is for our chairman, Dr. Khalid. Please join me to welcome Dr. Khalid. The floor is yours.
Thank you very much all. Ladies and gentlemen, as we draw the Quality in Healthcare Forum to close, I would like to express my heartfelt gratitude to each and every one of you, the committee, the speakers, and the respected audiences, for your dedication to improving the quality of healthcare in the kingdom. Since the morning, we have engaged in enlightening discussion, shared innovative ideas, key recommendations from leading experts. As we return to our respective roles and organizations, let us carry forward the knowledge we gained here. Remember that each of us has a role to play in enhancing healthcare quality, from healthcare providers to administrators, policymakers to researchers. In closing, I encourage you to continue collaborating, innovating, and advocating for healthcare quality. Together, we can create a future where every patient receives the highest standard of care, where safety is paramount, and where compassion and empathy are integral to the healthcare experiences. Few of the main recommendations shared today include There should be a focus on the role of the technology and AI in quality of care, the role of the resilient leadership and its impact on delivering quality of healthcare services, the important role of the support given to the healthcare professionals by policymakers and regulators. Healthcare institutions should put great focus on the whole journey of patient experience in order to improve the quality of healthcare services they provide. Thank you once again for your participation, and let our collective efforts inspire a brighter, healthier, and more safe future for all. Thank you very much. See you next year. Thank you.